e também a Organização Internacional do Trabalho. O objetivo central é investir na saúde e na produtividade, e também na produtividade dos trabalhadores com redução dos custos com tratamento de doenças. O Global Health Workplace Awards and Summit 2015 está discutindo 3 grandes temas: percepção sobre os investimentos em qualidade de vida e produtividade, bem-estar e o futuro do trabalho no mundo, e uma parceria público-privada em saúde com qualidade de vida. Nós gostaríamos já de imediato de agradecer e registrar também a presença de representantes de algumas empresas ao longo do nosso evento. Paulo Kraus, da Marisol, Arnaldo Altini, da Sol Paraglides, Hilton José da Veiga Faria, da VEG, Renata Paganini, Andrea Tomazini, ou Tomazoni, da Sopasta, Sérgio Matoso de Lima, da Sincol, Erasmo Pereira e Fabrício Martins, da Detroit, Paulo Oliveira, dos Correios, Adriano Dias e Sheila Herr, da Digitro, Wagner Zancarão, da Eliane Revestimentos Cerâmicos, Eliezer Matos, da Coteminas, José Altino Comper, da Círculo, Ronaldo Baumgarten Júnior, da Baumgarten, Urrit Kuhn, da Companhia Hering, Mariângela Vruck, da Tecnoblue, Lino Holden, da Holden Artefatos de Madeira, João Stramoski, da Metalúrgica Rio Sulense, Nivaldo Fernandes, da Termotécnica, Neida Berri, da Tigre, Marco Aurélio Gonçalves, da Dacol. Registramos também as presenças de João Odair de Lima, da Paraty, Marisa Fantin, acionista Paraty, Gerhard Degen, da BMW, Mário Lansnaster, da Aurora Alimentos, César Valiati, da Secrisa. Agradecemos também Leonardo Zip, também da Secrisa, Eurides Luiz Mescoloto, Eletrosul, Múcio Medeiros, Eletrosul, também da Eletrosul, Muriel Lino, da Tractebel, Euclides Baques, da Cristal, Cecília Aguirre, e da Áurea da Costa, Pioneira da Costa, também da Pioneira da Costa, Karina Costa, Priscila Valadão, da Dalto, da ArcelorMittal Brasil, Dalmese Binotti, da ArcelorMittal Brasil, da Fan, Mário Sérgio André Silva, Adriana Orbachuk, da Embraco, Simone Melo, da Petrobras, Cíntia Carla da Silva, da Roche, Cassídio Girardi, da Eletroaço Autona. Também registramos a presença de Sérgio Almeida, da Estaleiro Navship, Roberto de Assis Fernandes, da Clabin, Wilson Cordeiro, Lear do Brasil, Hermes Tomedi, da Procave, Gilberto Heinzelmann, Zen Metalúrgica, da mesma forma Shirley Freitas, Elci Pascoal, da Telefônica, Edson Grando, da Dami, Cláudia Marcon, Começo de Vida, e Andréa Salsa e Margit Loss, da Rede Globo. Sendo assim, nós prosseguimos com a apresentação das empresas finalistas do Global Health Workplace Awards, agora na categoria Empresas Multinacionais. Mais uma vez, nós convidamos o senhor Wolf Kirsten para que faça a condução destas apresentações.
Boa tarde a todos, especialmente bem-vindo aos executivos. I'm impressed, I really am. That list was never ending, so I would like to thank you on behalf of the Global Center for Healthy Workplaces for coming, spending your valuable time, and I think we will not disappoint you. I think the afternoon program is very good. And I actually recognized, in terms of the company names, quite a few who have either applied to our awards program, and also I recognized a previous winner from last year, Telefonica. So again, congratulations to you for last year's large enterprise category win. So again, from my heart, a very special thank you that you all came here to the Global Summit, Healthy Workplace Summit. So the first item here this afternoon is our final round of finalists, and it is the multinational enterprise category. Again, we've had some really good applications for this category. very competitive. And as you will see, the two companies which are about to enter the stage. So I'd like to ask Janice Davis-Street from Chevron and Ron Joins from GlaxoSmithKline to come onto the stage. And let's give them a hand, please. So, just so everybody's informed, and for those of you who have joined this afternoon, each presenter, each company will get 20 minutes to present their case study, and that which will be followed, after the two present, it will be followed by a 20-minute question and answer, mainly from the questions will come from our 5 judges, which are sitting right in front here. So I think I'm ready to go. Oh yeah, one more thing. I got a special instruction from the judges that in terms of your answers for the Q&A session, to keep them brief. So maybe a minute or two, but not longer than that, because otherwise not everybody has a chance to ask a question, and I'm sure you can do that. So Janice, you're up first. Thank you.
Boa tarde. I am very honored to share with you the Chevron Wellness story. Chevron prides itself as being the energy company most admired for its people, partnership, and performance. And what I hope to do in the next 19 minutes is to share with you how we care for our people. As one of the world's largest integrated energy companies, we are responsible for exploration, extraction, and getting energy to businesses and customers across the globe. We have a workforce that's extremely diverse. We number 61,000 workers worldwide, and that only includes our employees. We have about 4 times that many contractors. And our employees are not only diverse in terms of where they're located. We are in 140 or more countries across the globe, but they're also diverse in terms of the kinds of jobs they do. We have workers in laboratories, office buildings, rigs, refineries, very diverse locations, sometimes in very challenging work environments. In 2014, we produced 2.6 million barrels of oil equivalent production per day. That's beyond my comprehension in terms of counting. And of that volume, about 75% of that production came from outside of the US. So having a global focus and being able to provide resources to that diversity of a target audience has its challenges and multiple opportunities. We are very much focused on delivering the energy that the world needs safely and reliably. So safety is a huge part of what we do, and it's a core belief. And if you've ever worked with anyone from Chevron, you know that we bleed safety. Another core belief for us is around the interrelatedness between the workforce, the businesses, and the societies where we operate. In the next several slides, I'm hoping to share with you Chevron workers doing wellness, because I think wellness needs to be an active thing. It's not just something we talk about, but it's actually something that we do. It's a really exciting time for us at Chevron. I work within the wellness team in the Global Health and Medical Department, and we are in the 2nd year of a global strategy, and that strategy is focusing on us having a vision as a strategic partner for the health of the business. And highlights of that strategy is that we provide whole person health to the business by providing top-tier, best-in-class programs and services in the area of health and wellness, that we enable safety and productivity, making that a competitive advantage for Chevron. And last but not least, that we are able to be an effective business partner, partnering with the business, especially around decisions that have a health-related component. The healthy workplace model is something that's very near and dear to our hearts. On the right, what we've done is taken that center continuous improvement piece and really taken it into Chevron's lingo, so to speak, and merged it with our own systematic continual improvement process, which really relies on data-based leadership. How do we do this? We have as our strategic goal keeping the healthy healthy and decreasing disease risk. We have a very strong focus on prevention, not just disease risk reduction. And there's three main elements that we focus on, and those are leadership, engagement, and support. How do our managers, how do they champion wellness? How do they show their support of wellness in a visible manner? Our supportive policies and environment, making sure that they are consistent with what we're talking about wellness. There's nothing like having a pizza party to celebrate wellness. So making sure that they are consistent messages that we are sending with our policies and environment. Our third area is around health and wellness programming, making sure that our programming is sustainable, making sure that it's evidence-based, because there's always the flavor of the month, we call it, where people try this, try that, but really looking at the literature and making sure that there's a good evidence base of success in terms of our wellness programming. And then I like to say that data is the story that ties it all together. Whether it's data around your planning and your process metrics, or whether it's data that's showing your impact and outcomes. So starting with leadership and engagement and support. In many of our locations, our leaders model wellness behavior. In Nigeria, they did a Red for a Reason campaign where they were focusing on high blood pressure and making sure that they were actually going to the work site. They called it bringing health to the workforce. And they actually went to the offices and to the various locations across the Nigerian locations and took people's blood pressures and really saw some people who had some significant issues. And our managing director at the time was a very visible and enthusiastic supporter. Other areas where we have really seen leadership engagement and support around our health and medical strategic advisory board, where the business is able to give us guidance in terms of what we focus on, and it helps to keep us aligned with business needs. And then in some instances, so we'll actually give them a force. Areas where we've seen leadership support in risk. And in the Gulf of Mexico, which these two come from, we had messages from onshore and from offshore where they would talk about personal messages about why they were scheduled for their preventive wellness exams. And this campaign has been really well received in the Gulf of Mexico, with all kinds of faces going about doing their work, sharing their stories of why they've being champions of doing their preventive health exams. And this has been a very good demonstration of leaders doing more than just talking about wellness. The middle picture is actually one of our health fairs. Our health fairs are usually very visible examples of promoting wellness, and our leaders will frequently be either very visible in their participation in the health fairs, or in some cases they will send out emails endorsing our health fairs. And then at the bottom, we've got leadership support of walks within the community where families and the community can get together to increase awareness about health conditions that are very significant in our population, heart disease and HIV/AIDS. One of the other things that I'm really excited to share with you is how we have really embraced NIOSH's total worker health perspective. And the total worker health perspective, if you're not familiar with that, looks at how do we integrate health protection with health promotion. And it really looks at how do we look at the workplace, the employment and workers, and what are the opportunities to increase health and to decrease injury and illness. It really ties very nicely, I think, to WHO framework. And some highlights of how we've done that is around our HIV/AIDS policy, some of the psychosocial factors, some of the more tangible things that look at productivity, looking at our changing demographics. We've also looked at health behaviors and how do we support workforce engagement in health and wellness. Around the discussion of supportive workplace and policies, we have worked very hard to partner with our vendors to make sure that healthy food is accessible at Chevron cafeterias. We also look at making sure that there's walkable spaces. One of the things that we're really very proud of is the fact that the business will invite us, if they're building a new building, to find out what do they need to do to make sure that the fitness centers are built in a way that supports wellness, or to make sure that there's walkable spaces. So this is a really, really good example of ways that we are able to influence the workplace environment. We all know, and with this audience, I don't need to convince you about the linkage between health conditions and health costs and productivity. But what we have really tried to hone in on is around the linkage between health, good health, and productivity and safety. We at Chevron, we haven't really spent a whole lot of time coming up with complicated ROI calculations, not because that isn't important. I think our leaders see the value of health and recognize that it's important, but we also recognize that in our business environment, cost avoidance is as important, if not more important. So for example, it's the heart attack that doesn't happen. It's the pre-diabetic that doesn't become diabetic. It's the person whose hypertension is discovered early. It's the child that doesn't get HIV/AIDS. Our focus is heavily on prevention, and sometimes that's a little bit more complicated and complex to put a dollar to. We have stories about, a lot of the evacuations from some of our remote locations are around chronic diseases, about a heart attack. So if we are able to put programs in place that are prevention-focused, that prevent some of those things from happening, we see that as a dramatic way of determining the impact of our programs. Next on, let me talk a little bit about our programming. We've chosen strategically to focus on cardiovascular disease. We all know that cardiovascular disease is the #1 cause of death globally, and for our workforce, that's no exception. We have quarterly programs that really hone in on the risk factors for cardiovascular disease and stroke. In Q1, we focused on risk recognition. This quarter, we're focusing on eating better. Third quarter, we'll be looking at physical activity. And in fourth quarter, we'll be looking at sleep. What has been really interesting about this approach is that these campaigns are usually featured by toolkits, quarterly toolkits that provide information to our global audience, translated into the local language, and then we hand it over to our contacts on the ground who are able to personalize it and modify it so it's definitely more fit for purpose for the location. Because something that would work in my office building in Houston, Texas, may not necessarily work offshore in Angola. So we really do provide tips and guidance in terms of how can they take this central core messaging and make it very fit for purpose in the environment that it's being applied. Our signature program is called the Healthy Heart Program. It begins with a health risk appraisal, which is offered both in a paper version and online. And then employees have access to tools and resources that support the reduction of cardiovascular disease risks. And you can see here the range of focus areas are both in the physical realm as well as in the emotional health, the mental health area, and really does cover a nice cross-section of health risk factors. The health risk appraisal in the countries where we've deployed it are actually available not only to employees, but also to their adult dependents. So we have a very strong knowledge that especially in a workforce that's very heavily male, if you can get some messages home to their significant others, that you might be able to have a little bit more inroads, especially with our population that's an older male population predominantly. So the Healthy Heart Program has been deployed to 13 countries in 6 languages. Our eligible population, we haven't quite reached all of our Chevron workforce. Some of our locations just have very small numbers, and so we've actually started with the bigger groups that have between 400 all the way up to over 3,000 outside of the US. In the US, we are at 26,000. And so to date, we feel very good about the amount of uptake we've received, and we've actually been able to demonstrate some good results. We've seen since this new version of the program, this version of the program was deployed late 2012, we've actually seen risk migration. We've seen the number of low-risk individuals go up. We've seen the number of moderate risk and high risk individuals come down. We've seen improvements in specific risk factors, and we've seen the potential for a heart attack in the next 10 years. We've seen that number be very significant. So we've really been very excited about this opportunity to influence our workforce in this manner. Another feature of the Healthy Heart program that really we think is very helpful to improving the health of our workforce is the kind of systematic program integration that we've been able to employ. So once a person takes the health risk appraisal, online they're automatically routed based on their responses to the appropriate referral group. So if their answers show that they are at high risk for emotional distress, they automatically will get a message as part of their health risk appraisal report about information about EAP. Or if they're within their encounter with a coach in the locations where a coach is provided, they talk about ergonomic pain. They're immediately able to be referred to our ergonomic group. So the referral system within the Healthy Heart program is very systematic, and it ties not just to some of the resources within health and medical, but also ties the individual to some of the other occupational health resources, to our fitness centers, to our disability management resources as well. Outside of the US, while this network of program integration does not have quite as many circles, we do similar signposting where they're able to be referred automatically after they do their risk assessment to the health and medical department or to EAP, so that we make sure that people are seamlessly referred to the right resources. And conversely, those groups are also educated and aware about the program so that they're able to make referrals back to the Healthy Heart program as appropriate when they are encountering those participants. So these are just a little collage of some of those health and wellness programs. So you'll see images from walks in Philippines where they have really taken on very altruistic motivation. They do walks to raise awareness and sometimes funds for things like the tsunami or whatever local disaster, and unfortunately they've had quite a few. In malaria, focusing malaria in Angola, group community exercises in malaria, Panama walks to raise awareness about health issues, looking at nutrition opportunities, and then Red for a Reason, looking at ways to increase awareness around the dearth of heart disease. One of the other areas that we are really very excited about is being able to tie the message to safety. As I mentioned, we are a very strong safety culture, so that when you're able to tie your messaging of health to some sort of safety message, that really does resonate within our workforce. Our peer health educators have been recognized internationally, especially with their work in the area of HIV/AIDS, malaria, and TB. We have actually taken that model and added to their curriculum information about nutrition, exercise, diabetes, and cardiovascular disease health. And this has really been a very positive thing because now you've kind of destigmatized the conversation. And so when they're talking to somebody, they're not immediately assuming that they're talking to them about HIV/AIDS, which is where the peer health educator movement started. But they're talking about health. They're talking about whole person health and being able to tie them to the appropriate resources. Some of the things we are looking at is expanding this model from the areas where it's been so successful, namely Angola and Nigeria, to some other locations like our shipping or other more remote locations. We're having peer groups, which are non-medical folks who work and side by side with you, talking about health. And we're also looking at how do we tie this messaging to some of our new emerging efforts in the area of resilience. A global company, travel is as much part of what we do. And even in our travel health resources, we've tried to tie together health protection and health promotion. So along with the usual suspects, like making sure people are immunized for their travel, knowing what the disease that are specific to the area that they're going to, we also provide them with nutrition information, exercise information, and sleep health, which is a really big one for, especially for those who came from 30 and more hours away. Being able to provide them with some of the other health promotion aspects as well has been a very positive thing. I wanted to share with you some other highlights of our programming. Our global EAP does a lot of really good work, not just in terms of individual psychological health, but a lot of work around organizational psychological health. Our work-life programs, very, very robust. They also, with their knowledge of the Chevron workforce, we were able to do some very good work there. Our public health group does a lot of really good work in terms of malaria, HIV/AIDS, TB. They've done things like getting nets to locations, making sure that we continue our work in decreasing the transmission of mother-to-child transmission of HIV/AIDS, and many other aspects within the community. One of the things that we're really proud of with our public health group is, the development of unbranded materials so that those materials can be used very easily within the community. Our Global Wellness Network is something that we've now been going on to our second year. And in our Global Wellness Network, this is a group of health practitioners or anyone who has a passion or a heart for wellness across the globe. We meet 4 to 6 times a year, and we share best practices. We have found that the good stuff is not always from the West. A lot of good stuff comes from across the waters. And this is a really nice opportunity for us to learn from our colleagues. Another point that I wanted to talk about was around data and metrics. We really looked at different aspects: reach, retention, results, value, and how it ties to our operational excellence goals. We have a wellness scorecard that ties back to those 4 factors: leadership engagement, policies engagement, best practices, and data and evaluation. We try to tell the story about our programs not only individually, but also to the business. On the right side, you'll see some of the data we will provide to a business unit. That allows us to give them information that tells them what will we do next, what areas will we focus on next. And a big part of that is making sure that leaders have enough information to communicate about programs. We are working on an integrated dashboard that will be looking at things not just about risk stratification, but also looking at things like EAP visits, what are our top costs, how is our ergonomic data. It's also tied very much to our scorecard as well. We've had lots of learnings along the way, having a unified brand and recognized programming, looking at metrics, looking at culture beyond translations, knowing that communicating is not just about telling people stuff, but it's also communicating about behavior change is very different. And then really looking and relying on local programming, looking to make sure that what we're doing integrates very well. So in leaving, Buddha says that each human being is the author of its own health and disease. We believe that the workplace is a way to influence the pen, the tablet, the PC, or computer, whatever tools that worker needs to be the author of their health and disease. And we believe that health is an enabler of safety and productivity, regardless of where our employees work. Obrigada. Thank you for your attention.
Boa tarde, buenas tardes, good day to everyone. My name is Ron Joins, and I'm the Vice President and Global Medical Director at GlaxoSmithKline. It's really my pleasure to be here to represent the work of literally hundreds of people, not just in environment, health, and safety, but in HR, in our facilities group, who all combine their efforts to create a healthy culture at GSK. I'd also like to extend a special thanks to Dr. Carla Decatelli, who's here in the audience. She's our Brazil, LATAM Health and Productivity Leader, and she's doing a fantastic job. So over the next 20 minutes or so, I really hope to share with you an overview of how we have approached health at GSK. And I think you'll see we take very much a public health approach, applying public health methods in the private sector, how we measure our progress, in creating a sustainable culture of health at GSK, the key programs that make up that culture of health, and then I'm sure you're going to want to know how we've done with our progress. How have we performed? So I'll share that as well. But first, I have to begin with our organizational context, because that's the context that we work in. We're very fortunate to work for a company whose mission is health. We're a science-based company helping consumers, helping patients do more, feel better, live longer. So you can see instantly there's a very clear alignment between our external mission and our internal mission as a group, right? So every company should be able to draw that connection between their external mission as an enterprise and the work that they do in health and how that supports the business objectives. Now, if you're going to complete any mission or any journey in life, you need to know the answer to 3 vital questions, right? Where am I starting? What's my baseline? Where are we going? What's the destination? What's the goal? And where am I at any given time along that continuum? So our application focuses on a tool that we use for measuring our progress along that journey towards a healthy, high-performing culture. We call that measure the healthy organization measure. Very simple. I'm going to show you a couple slides of our business just to take a little deeper look at the context in which we work. One of the design criteria for our healthy organization measure was that it had to work in a complex and diverse business. You'll see 3 things instantly. You'll see we're a very big company, over 100,000 people in 115 countries, each one with its own culture and its very different definition of what it may be to be healthy. GSK is also complex, like many other multinational organizations. We have 3 core business units. They are pharmaceuticals, vaccines, and consumer healthcare, but we also have a massive manufacturing organization with over 80 sites and a large R&D organization. It's like having 5 businesses in one, so our measure had to work across all 5. And like Chevron, our workplaces are very diverse. They range from the virtual, that we heard a little bit about today, to offices, labs, and manufacturing environments. So it's really important to understand this context because we have many of the same multinational challenges as other multinational organizations, and we've been able to come up with a practical solution, I think, to measurement globally. Last slide about the organization. You need to know a little bit about our journey as a company and our journey in health. So the first thing you'll notice, we're a very young company. GSK was born in 2002, so just 14 years old. I think our health journey can really be divided into kind of 2 chapters. Chapter 1 is really creating a global framework of health policies and standards and governance within the organization. Chapter 2 for us, you see here in purple, started in 2005, and we really recognize the importance of mental well-being and resilience to the organization. And we developed a strategy that includes primary, secondary, and tertiary prevention to address mental well-being. Chapter 3 for us has really been about globalizing access to physical health, increased access to preventive health care, and beginning to understand our health culture. But what's really been transformative for us is Chapter 4. You see, starting in 2014, engaging leaders and increasing accountability and awareness. So our goal is that the leaders in the organization, and not the support functions, are accountable and responsible for the health of their employees. So our healthy organization measure and another intervention that I'll share with you are key to promoting that leadership awareness and accountability. You now know a little bit about the company, so let's talk a little bit about the needs of our workers, because they were incredibly important in shaping this measure and our focus areas. So we looked at the leading health risks facing our workers both currently and in the future. To shape this measure, we analyzed our sickness absence data, where we had country-specific sickness absence data. Where we didn't, we used data from Ministries of Health or the World Health Organization's DALIs, which you're probably very familiar with. And based on that data for 2014 actuals, and using the WHO projections for the countries that we work in, it's evident that our health strategy and our scorecard absolutely must address depression, mental health and resilience, the prevention of non-communicable diseases, and infections, such as vaccine-preventable respiratory infections and HIV, of course. You'll also see road traffic risks and other injury risks are key causes of disability for us. They're a part of the safety element of our environment, health, and safety strategy, and I won't cover those any further here. So you need to know now, how did we respond? What is our strategy? Our strategy was really focused on two aspirations: a healthy, resilient, high-performing workforce, and causing zero harm to employees in the communities that we operate in. So the Healthy Organization Measure really defines our starting point and monitors our progress in 4 of the key 7 focus areas that you see here at the bottom. Here are those 4 areas. The first is managing our public health risks. The second is increasing human energy and resilience. The third is building healthy leadership practices. And fourth, healthy workplace design. If any aspects of these cultures are weak, like a 4-legged chair, if you take one leg away, the culture falls, right? So we believe that for GSK, all 4 elements must be in place. So we created a measure for those 4 elements. This is the Healthy Organization Measure, and I'll walk you through the design. You see in purple, it has 4 dimensions. Healthy leadership at the top, healthy facilities, healthy minds, and healthy bodies. Yeah? Each metric has 1 or 2 globally validated measures beneath it with baseline performance data and annual targets. The dimensions, you'll notice, are weighted. They add up to a score of 100, but they're weighted. Some have high scores of 20. Those are healthy leadership, knowing health needs and taking action, and the use of our energy and resilience plans. And that's because our data shows that those 2 areas are the highest impact in GSK. But of course, those alone are not sufficient. We have to have healthy bodies to carry those healthy minds around in, and healthy facilities. I also want you to recognize that this is not an environment, health, and safety scorecard. This is a GSK team scorecard. So EHS owns some of these measures, our facilities group owns some of these measures, our HR benefits group owns some, and our HR organizational development, who's responsible for shepherding the culture, owns some as well. So you'll also see highlighted across the top 4 orange words. It shows that this scorecard can be reported at enterprise, business unit, remember we have 5, region, and site level. So why did we design it this way? The first goal was to raise leader awareness and mobilize them to take targeted action, both based on local and global priorities. Secondly, it's designed to unite the 5 businesses towards a common health goal and to unite the 3 key partners in health in our organization to support them. So that's HR, facilities, and environment, health, and safety. Third, it helps us grow some innovative programs that we know have the biggest impact on our population, and I'll talk about some of those later. It certainly promotes accountability and sustained improvement. We set targets through, for some of these programs, all the way to 2018. And I'm sure you'll see it touches virtually every aspect of the WHO Healthy Workplace model. Okay? So let's talk a little bit about how we foster leadership commitment and alignment, because I think we do some really innovative things here. And it begins here. Let me explain this. This is our leadership expectation framework. It's not a health program. It applies to every job in GSK, from the CEO all the way down to the manager. It was introduced in 2014, and it defines the expectation for us of how work gets done, not what is achieved, right? And so every manager, as part of their annual or quarterly performance review, is evaluated not only on their objective progress, but their subjective progress in meeting these 6 leadership expectations. The key one is right in the middle, releasing energy. Quite simply, that expectation means that all leaders are expected to accomplish their goals in a way that fosters a healthy, energizing, and inclusive way of working that doesn't compromise well-being. So our measure, the Healthy Organization Measure, in supporting programs, help the leaders to release more energy in their organizations and create plans to identify, to meet gaps that have been identified. So as mentioned earlier, it helps leaders track these progress on 7 key areas across 4 dimensions of health. I only have 20 minutes, so I can only talk about a couple of the elements. So I'll begin with our health needs assessment. So this is one of our highest weighted elements, and it was really designed to make sure that local needs are considered equally with enterprise-wide priorities. So I'm going to walk you through the output of one of the health needs assessments. These assessments are done at all of our global locations with more than 100 employees. We use simple tools. We use Select Survey to deploy a survey. You could use SurveyMonkey. And we use Excel to present the health insights in a 1-page summary for management. A sample site profile is what's going to be presented here. So first, there's a scored assessment, as you can see, to show if key elements of a health programs are in place and in use. And they include 12 dimensions of a health management system. Basically, the larger the green bar, the more robust the program. And so at this site, you can see very clearly the smallest green bar is mental health, energy, and resilience. And leaders know instantly at a glance, that's a program that needs some energy put into it. Yep. Secondly, we measure the impact of health on the business locally, and importantly, the impact of the business of that site on the business as a whole. Both of those elements are scored, and they give us an XY coordinate for a given site. So here you'll see this site plotted. The diamond represents that site's performance, control versus the impact on the business. And you see an ideal performance envelope here. If the site's out of that performance envelope, the business leader knows it instantly. Yep. So the output from this health needs assessment is typically a locally driven action plan that works on 1 to 3 issues. So the main advantage of this particular metric is it ensures that local issues are included in our overall approach. This health needs assessment data can also be aggregated in a variety of different ways. This is an example from our Asia Pacific manufacturing sites, and we have, I think, about 15 of them. And you'll instantly see there's a cluster of sites that fall outside the desired performance envelope. So the leader sees that, and he gets some business-specific insights, and it helps him to, or her, prioritize resources to address needs or gaps, so they can make evidence-based choices. So this healthy organization measure has also helped us grow some very innovative programs, and I'll cover a few. The first I want to start with is Healthy Minds Dimension, our energy and resilience programs. So you remember we started working on these back in 2005. This is our suite of energy and resilience programs. They help employees build energy management, resilience, and mindfulness skills. They've been extensively studied within GSK and proven to enhance leadership practices, engagement, energy levels, and change health outcomes. These programs can be done at 3 main levels. In orange, you see programs that can be done at either the individual or team level. Our flagship program is called Energy for Performance, which is based on the corporate athlete program. It's our version of that that you heard earlier from Unilever. There are also programs that can be done at the individual level only. So we have online programs that introduce people to energy management concepts and help them build skills in meditation and mindfulness. And then we have tools that are focused purely on teams, shown in purple, such as our Team Resilience Assessment, which is a pressure assessment for a team, and an action plan that is designed to create solutions to those sources of pressure. So the next really innovative program I want to talk about is one that we call Partnership for Prevention. And this aspect of the measure measures our progress in deploying this program. It's a partnership between GSK and the employee to increase access to and use of preventive health care. This program includes 40 evidence-based, free or low-cost preventive health care services. And they're shown here. They range from childhood immunizations to adult immunizations to smoking cessation, HIV screening, and treatment, full prenatal care, and screening for the most common cancers that affect GSK employees and their families. So this is actually an example of, I guess you would call it a private-private partnership. So I'll tell you a little bit about how we achieve this. If a service is not covered in a national health plan or an existing health insurance plan, we change our contract, or we negotiate a new contract with the healthcare insurance provider to cover these services at no cost, which is our design target, or low cost. Thus far, we've been able to implement these programs with no cost to employees and their families. So you may want to know, how did we decide how to implement this program? Well, first we had to assess the gaps in the current insurance and preventive health care coverage. So the neediest countries here for us are shown in blue. The moderate needs countries are shown in orange. And the low need countries that have good benefit coverage already in Western Europe and North America are shown in purple. So after we had done this diagnosis, we needed to prove this concept, right? So we piloted this program to see if we could do it in 4 green countries: Ecuador, Nigeria, Ghana, and Romania. After successful pilots, we took this program to our board of directors, and they gave us the green light to invest over $100 million in deploying this program globally for all of our 325,000 employees and their families. Okay. You might be interested to know the order in which we're deploying this program. Those countries that have the fewest needs, North America and Western Europe, are going last. The way it should be from a public health perspective, eh? So this partnership with health insurers and providers has actually had some really unexpected impacts for us. It started conversations among employees with their families about the value of prevention. And remember, we make vaccines, so that's a great conversation. It started employees speaking to their neighbors, and they're creating an expectation that, well, maybe their neighbors should have this kind of coverage as well. It started to change provider behavior as well. So you can imagine if a GSK employee goes in and says, all these services are covered, can you give them to me? They're appropriate for my age and risk, but the provider hasn't done that in the past. That's going to start to change their practice patterns. And it changes the ordering patterns for hospitals as well, that now have to stock medicines or vaccines for our employees. And that begins to have a ripple effect to other physicians. It's also started some insurance plan design changes. So when we initially launched this program, some of the insurers said, wow, this is a very risky custom GSK plan. We don't know how to calculate the loss ratios. But then they got a couple years of experience with our plans, and now they're beginning to introduce plans like this as part of their standard plan design. And then finally, we compete with other companies like Pfizer, like Chevron, like others for global talent, right? So we're seeing other employers begin to build programs like this in order to be able to attract talent. So you'll want to know, how did we do? Here's our scorecard. Health needs assessed, we started 2014 with a 0%, a target of 60%. We achieved 72% by the end of the year. We're at 84% now versus a 99% target in 2015. Energy and resilience program uptake. We started our baseline at 10%. Our goal was to go to 15. We made it to 16%, a 60% increase in a single year. Countries with access to the Partnership for Prevention program. We started with 11, a goal of 20. We fell short, 16. So that started a conversation in senior leadership about why, and a redirection of resources. And now we're at 31 countries, well on to our target for 2015 of 42 countries. Our overall score on the measure was 94% as an organization. So in conclusion, we've had a lot of successes at GSK, but perhaps our greatest has been the practical execution of this scorecard, the Healthy Organization Measure. It's gotten leaders to take action. It's aligned key partners in the organizations to a single strategy. It's focused our efforts on a combination of local and global programs that make the most difference. It's sustainable. We have long-term targets, and that leadership expectation is around to at least 2019 for us. So this approach and the philosophy and the tools behind this, I think, can easily be used by other companies. Start following a 3-step recipe, right? Identify the health needs of your people, the critical dimensions and partnerships of a healthy culture in your organization, and create a simple plan with off-the-shelf tools to track your progress. So I'd like to thank you for your time and energy, and I look forward to your questions. I've got my book to write them down. Thank you.
Wow, amazing the global reach these two companies have and what impact they have on population health, and with that on global health. Amazing, I think. Last year we had, in the multinational category, we had IBM and Unilever Global on stage, and they were fighting it out. So again this year, 2 excellent programs, and again, I really don't envy the judges to make their deliberations or their scoring, but they got to do it. So now is the time for questions, and I'll hand it to the judges. Go ahead.
Oh, well, congratulations, really world-class programs. Congratulations. I have 2 short questions for Chevron. As a gas company, sustainability, relationship with the environment, with the community is very important. I want to know if is there any bridge in connection between health, wellness programs and corporate social responsibility and sustainability. And it's also a very important avenue of interest of the WHO model. I want to know something about it. And for GSK, I saw the top causes of disability. And in many countries, in many places, musculoskeletal disorders are among the top. I want to know the reason why it's not among the top. Maybe underestimation, prevention. Oh, I don't know. So I want to know, because also in pharma, some surveys show that musculoskeletal disorder is a big issue.
So I'll address the corporate social responsibility piece first. Our focus outside of the US in the CSR space has heavily been on the prevention of mother-to-child transmission of HIV/AIDS through a lot of public-private partnerships across the regions of the world where that has an impact. And so that has been a focus, and we have begun to move some of our efforts in the health and wellness space from the same focus for our CSR into some of the non-communicable diseases space. I believe the other question was around sustainability, I believe. Same thing? Okay. To touch on sustainability, I think with a workforce that's aging, I think we are going to be in business for quite a while taking care of our workforce. Most people in our environment are there for 30 years. We still are one of the companies where we consider ourselves a long-term employer. And so the vision is that because we see people as one of our primary resources and the need to invest in the labor pools where we will be getting our future workforce, it has tied our health and wellness programs very nicely to our CSR goals of maintaining the labor pools of our future workforce. And a lot of this helps Chevron to be the provider of choice because when we go into a region through our health impact assessments and other tools, we are able to influence not just our workforce and their families, but also the communities.
So I shared your surprise that musculoskeletal conditions weren't in the top 5 for us. But recall that those lists are based on the GSK sickness absence data and global data or local data where it does not exist. So they did not end up in our kind of top 5 focus areas. Granted, they cause a huge amount of presenteeism and less absenteeism, as we heard earlier in this session. So they are clearly very important issues. They're addressed in our workplace health and safety program, our occupational health and safety programs. They're addressed in our facility designs. So our new standard design, as an example, promotes taking the stairs instead of elevators. They're hidden. 90 to 95% of employees have sit-stand workstations, and nobody has a personal printer or trash can anymore. You've got to get up to throw your things away or pick up your things from a printer. So we're building movement into the design of our facilities, and our energy and resilience programs, particularly Energy for Performance, focuses on helping people build fitness, movement into the way they live their life and manage their energy. And that, of course, is helpful in preventing, as you know, musculoskeletal disease, but also managing it. And that physical activity also has a significant impact on depression and anxiety, as you know, as effective as many medications in controlling symptoms. So I hope that addresses your question.
Well, congratulations. I think, like Wolf said, it's going to be pretty tight like it was last year, but a déjà vu, I think. Yeah, fantastic. Very worthy finalists. I just want to pick up on something that Janice was saying in a question to both of you. So you're both knowledge businesses where the expertise and know-how of your workers is a big source of competitive advantage. How do you make sure that older workers, perhaps with chronic conditions, including early cognitive decline, are supported to remain productive and fulfilled at work?
That's an excellent question. So I think that there is a lot of training and internal workforce development that's done to make sure that there's continual training for our workforce. And there's lots of good resources for our workforce if I think that there are opportunities for cognitive. That's an interesting question. I've got to think about that one a little bit. I don't know that we have a whole lot of demonstration of that our older workforce has cognitive decline, to be honest with you. I think we have more of a demonstration of physical decline. And I remember seeing some information from the head of NIOSH that really pointed more to the physical decline aspects than to our cognitive decline aspects. We have global diversity networks that provide supports internally. So the Boomers Network is one place where I would say that there's support for individuals. There's EAP support that I think would also play into that space. And I think a lot of effort is really going on training the next group of our workforce and making sure that our current tools and resources keep our people in the best shape possible that will focus on not just maintaining their bodies, but also in terms of maintaining their minds.
So our focus is twofold, I would say, and it's fair to say that it's evolving. First approach, of course, is prevention. We know many things that prevent cognitive decline, so we try to encourage those. Oh, thank you. The second, though, specifically directed to your question, is how do we evaluate and accommodate people with early cognitive decline? And I think I would say we have a global standard on attendance management. That standard and those programs and policies require reasonable accommodation for workers with physical, mental, or other perceived disabilities or actual disabilities. So that program essentially expands the tenets of like the Disability Discrimination Act you might be familiar with, or the U.S. Americans with Disability Act globally. Do we have systems and processes to back that up and put it into practice? And the answer is no, not in 115 of the countries. I would say, and I'm going to give you an estimate here, maybe 10 of those. And I think that's an important improvement opportunity for us. Our CEO has just signed on to a major disability, I guess, initiative in the UK, because he's recognized that's a gap as well. So I think that might be the next chapter in our journey, but we're not there yet.
I'm going to join my fellow judges in congratulating you on very, very well designed and just stellar programs. The psychosocial dimension, or the sphere of influence, if you will, of the psychosocial environment in the WHO framework is not organized only around mental health or depression issue, but also has this notion of culture in it. Can you give us one example of what you've done to intentionally change the culture in your organization towards one of health and well-being?
I don't mind going first. So I think we've used our diversity networks very effectively to have some targeted messaging that will be focusing on not only on demographic groups. So we have our Boomers Network, we have our Women's Network. In the US, we have a Black Employees Network, we have XYZ networks. And so by using the networks as a way to support common needs and common issues, I think that's been a unique way that we've tried to influence the psychosocial aspects. Caregiving has come up as a big issue for our workforce, and having a place where people of like needs can get together and get those kinds of social supports and to learn more about some of the rich resources that they may not know about, but being in that safe environment where they can talk about what their concerns about caregiving, whether it be elder care or a sick spouse or child. Those, I think, have been a unique way of supporting things like young mothers within the Women's Network focus groups. It's really been a unique way to target some of those special psychosocial aspects that change the way we do work. And our VP of HR is very interested to know what the networks are talking about. So then we have that opportunity to talk with our leadership sponsor or with senior leaders to be able to share where we are hearing from our diversity group memberships of some of those specific concerns.
Nico, I think one of the most powerful cultural catalysts for us was the introduction of that releasing energy expectation as part of our leadership expectations in 2014. To give you the backstory on how that came about, you saw that we've been doing energy and resilience programs since 2005, and the business and the HR organization saw that those programs were impacting business performance, productivity, engagement, and leadership behaviors. And so, ironically, it was actually them that proposed that new leadership expectation to release energy in 2014. It wasn't our initiative. And that expectation, which is built into the performance appraisal and review process for everyone, from our CEO down to our manager level globally, has been incredibly powerful in getting people to recognize that, you know, good health is good business, and they're going to be held accountable for not only what they achieve, but how they achieve it across those 6 expectations. That's the one thing for me. It wasn't even a health intervention, but it was driven by health insights. That's been most powerful for us.
Yep, another one?
Yes, again, congratulations, well done. these are both excellent programs, excellent strategies, and I see a lot of thought being put into it. And so just to end off, I just want to ask a very broad question, because it's not easy having a global strategy that's being implemented across the world. So just want to have your thoughts, quick one, on what are the biggest challenges that you've faced, and what did you do to overcome that, to implement it globally? Thank you.
Two things I think were big challenges for us and have been catalysts for our success. The first was to create a strategy that embraced both kind of enterprise needs as well as local needs, right? Because North America has very different needs from sub-Saharan Africa, yeah? So our strategy and tactics have to be able to address health issues and risks and opportunities in both dimensions, enterprise and local. The second, I think, dimension for us that it was a real challenge, and it has been a big catalyst for growth, is this concept of leadership, accountability, awareness, generated by both that releasing energy expectation and the scorecard. It has just turbocharged, I guess, our performance in health. That was our critical dimension, critical insight, and it was a big challenge. As you saw, it took us from 2002 to 2014 to get the organization to the place, the culture to the place where it was that time.
So I would say that the biggest challenge for us initially was getting vendors to help support a global audience, and moving away from a one-size-fits-all approach. I think what was very evident to us was that in some locations where we do business, they're not ready to really have a wellness conversation. They're more concerned about getting to work safely, and more recent, they are dealing with things like Ebola, other really significant issues. And where do we put wellness in the perspective of some of the things that they're dealing with right now that are really important? And so being patient, and to, in those situations, use the time to develop a relationship of trust and rapport, so that when it comes time for us to start to introduce the idea of wellness in its very infancy stage, we've got that relationship, and then we're able to learn more about what's going on locally that we can then leverage. And I think being able to have that longer time to build relationships, to find out who the stakeholders were, so that when we do come in with our programming, it truly is suitable for the location, because now we've spent that upfront time and we've been able to recognize and identify what are the local resources that are already there that can support our efforts.
You guys good? Okay. I think we probably have to move on, so let's give them a big hand again for their program. Okay, moving on. I know we're slightly behind here. So I would like to invite a dear friend and colleague, Mr. Alberto Ogata, to the stage. I think many of you know Alberto. Alberto is a scientific advisor now for ABQV. He was the past president for many years. He's also a board member of the IAWHP, International Association for Worksite Health Promotion. Hold on. And he's also an advisor and judge, as you saw, to the Global Center for Healthy Workplaces. So a big hand for Alberto.
Bom, eu tenho a honra de apresentar o próximo palestrante, Nicholas Pronk, professor adjunto de Ciências Sociais e Comportamento na Escola de Saúde Pública de Harvard, professor visitante de Ciências e Saúde Ambientais da Universidade de Minnesota, Escola de Saúde Pública. Ele é membro de grupos de trabalho, governo americano, bastante importante na questão da obesidade. Ele foi fundador e presidente da Associação Internacional de Promoção da Saúde no Ambiente de Trabalho. Ele é autor do manual que é usado em várias partes do mundo, do American College of Sports Medicine, sobre promoção da saúde no ambiente de trabalho. É um manual que todos os profissionais que atuam na área devem conhecer e usam bastante. O professor Nico Pronk é autor de inúmeras pesquisas, publicações científicas, é uma das autoridades mais renomadas e conhecidas no campo da promoção da saúde no ambiente de trabalho. E eu acho que não há pessoa mais apropriada. Cumprimentar a organização pelo convite, ao professor Nico Pronk, que ele vai abordar a questão da construção de um business case, mostrando como faz sentido a relação entre promoção da saúde e o negócio das organizações. Então, o professor Nico Pronk agora recentemente ele começou a ser um excelente praticante de soccer, né? Football player. Então eu quero convidar para vir ao palco o professor Nicolas Pronk para proferir a palestra sobre a construção de um business case e a sua relação com os programas de promoção de saúde. Professor.
Good afternoon. And thank you very much, Alberto, for the kind introduction. I'm supposed to talk about the business case, and coming at it from I'm coming at this probably more from a United States perspective than from a Brazilian or rest of the world perspective. And it's recognizing the fact that in the United States we do have the challenge of healthcare costs that faces every employer. So I'm going to do my best to make sure that this is as globally applicable as possible. Now, in thinking through how to sort of think about this notion of a business case, my good friend Walter Bortz, a professor at Stanford University, reminds me all the time about this quote from John Gardner, and basically says, "He who wishes to effect social change cannot be of short wind." And that sort of tells us how difficult it is to make big changes. And I think particularly in this context of moving from a culture that is very much focused on treatment to one of prevention, that is a big, big shift. And so for those big shifts and how those things apply to the workplace setting, we need a strong business case. There needs to be a strong business case for those issues. Now, at the same time, when we talk about this business case, what I hear all the time in the context of prevention is that it takes too long to see the results. So the benefit that one organization pays for may actually not be accrued by that same organization. Now, I completely disagree with that. And here's the reason. I think if you think about what we measure in health, we actually don't measure health. We measure the absence of health. We measure disease. So what do you use as your measurement stick, your yardstick, to measure the impact of prevention and health promotion? It's the delayed onset of disease. It's a negative outcome that we're looking at. or it's the delay of productivity loss. It's measurement of productivity loss, not productivity. So actually then, that means that the benefit you get out of these programs is not delayed. The benefit is immediate because it delays the bad outcome. It's a conceptual shift that I think is extremely important because it directly goes to the heart of the business case. You invest in prevention, your benefits are accrued immediately. They don't come in late. And I think if you think of it that way, things start falling into place much easier. So I want to talk a little bit this afternoon about the setting itself, the workplace. Is it actually plausible that we can make a strong argument that there is a business case for investment in health? To specifically talk about what that may mean. Then the question of, if you agree that there is a good reason to invest, then we also need to talk about, well, what is it then that you would invest in? And how would you actually implement? So the business case cannot just be the why, it has to be followed by the what and the how. To get to those value outcomes, you need to pay attention to the how, and that's through design. So how are programs designed? What do we know about successful programs? What do we know about the principles that are helpful in shaping those designs and getting to those designs over time so that health and business performance can be linked? So let's just start off with a vote. See if everybody's paying attention. If I were to ask you, do you think employee health and well-being programs can improve health and generate savings? Who says yes? I'm glad to see we don't have a biased audience. There are probably some skeptics in the room. Okay, so just keep that in mind. We'll come back to this question. So is the workplace, is the setting actually plausible? What's going on in this setting? Is it possible to get to a business case, and because the setting allows you to get some valued return? Well, first of all, there is significant reach into the population of interest. So if we just limited it by saying our focus is on employees only, we can reach everybody. If we broaden it by saying it's employees and their families, you're going to have a strong reach. If it's even broader than that and how the families are situated in communities, then you can have still a significant reach through the workplace because the workplace is located in those communities. So reach is an important factor in actually getting to the population itself. Reach by itself is not sufficient. You also need frequency or exposure. How often can a message get through to the right people? Because people show up day after day, the messages can be, that exposure, that frequency can be expanded over time. And so program implementation can be highly frequent, messaging can be highly frequent, and it can also be implemented through different tools. So just think about tools, vehicles, or resources, such as benefits design, as an example. Organizational policies that by design reach everybody because it's changing the environment in which people do their work. Helping people figure out how to change behavior and supporting them in those behavior change efforts. So those are the kinds of tools and resources that are available because you're in this kind of a social system at the workplace. Work sites can also be sort of focused in on a targeting approach. So rather than saying we're going to work only, at that environmental level, we can also identify subgroups of particular interest. So some examples that have already come up, musculoskeletal disease, depression, as some of these issues that affect many, many work sites throughout the world. And so if you know that these things exist, if you know that people are struggling in these areas and there are a lot of people affected, this can then drive targeting approaches and get employees connected with resources or make changes at the policy or the environmental levels. And of course, interventions can be designed at various levels so that the interaction with the individuals comes from multiple influences. For example, you can try to make change happen at the individual level, but it's difficult for people. Think about just the simple message of telling people to quit smoking if you're a smoker. It's a simple message to give, but it's very difficult to make that behavior change if the rest of the environment works against you. So you can also, of course, organize around team-based approaches or interpersonal approaches and support people with multiple people around them. Organizational level approaches, policy changes at the organizational level, and then finally the environmental level. How do workplaces align with community policies or statewide or province-based policies? But there are significant gaps. So we've looked at this issue with a group of people. Actually, this was part of a collaborative with the Vitality Institute, where we asked the question, you know, if you were to pick a top 5 of issues to be addressed in order to make prevention truly work at the workplace, how can we make the workplace a more effective setting for prevention? What would those things be? And really across the board, there is still limited leadership and advocacy. When you think about prevention and you think about just the amount of support that comes in for prevention, it pales in comparison to the treatment paradigm. So that leadership really needs to step up in order to make this work. Leadership not only at what I would call the C-suite level, so CEOs talking to other CEOs at their peer level, those leaders interacting with each other and gaining a broader reach, if you will, for prevention at the workplace. But within workplaces, the leadership that shows up not only at the top level that sets a vision, but also the middle management level that allows the prevention efforts to go broadly across an organization. How many times do we see that leadership says prevention is a good idea, but there is a conflicting message at middle management that says, yeah, it's a good idea, but you still need to perform at this level. And then the middle management says, we can't do it all, so we'll let the prevention stuff stop. And then it doesn't go any further. And then, of course, once you have those leadership levels on board, you still need frontline leadership to get deep into your company. So that at least at 3 levels of the organization, there is strong leadership that shows up, that talks to each other, and you have top-down, bottom-up happening at the same time. Advocacy, particularly, I think, at the national levels, so that there is stronger support from the government sectors, particularly the financial resources that are being freed up to make these efforts happen. In the United States alone, you think about the advocacy that ties into opportunities for research, and research is actually is number 3 on this list. Very little research goes into prevention, comparatively, relatively speaking, but then when you put in worksite on top of prevention, it gets about, little attention. Then there is this issue of alignment between financial incentives and disease prevention. Those who invest do not receive the full long-term benefits. And I think I just talked about that issue. I think this is an issue of looking at the concern from the wrong direction. Sure, it takes 10, 15 years in some cases to see the full effect of some of these programs, but it's because we measure the absence of health. If we were to truly measure health, you would see it much faster. And so oftentimes in about 2 to 3 years, you do start seeing significant changes in productivity, or performance at least, looking at performance as a behavior rather than productivity as an outcome. there are clear indicators that there is value being generated in a fairly short term if the program is designed for that purpose. As I mentioned earlier, the limitations in research quality and investment. We do have lots of data coming out, but the quality of the design of those studies isn't always there. And that brings in sort of this concern about, does the data really tell us what we think it tells us? And so we need more high-quality research attempts and activities. And of course, that cannot happen if the funding isn't there. And that's where leadership and advocacy come in again. That investment needs to be there. Then, of course, there is regulation. So in the particular, again, the United States, from that perspective, the Accountable Care Act has come out, regulation that actually puts quite a bit of emphasis on prevention. So in a sense, it's a very supportive regulation for these efforts. Yet at the same time, in the same regulation, the language that is used around programs that we know work is very soft, very weak. So for example, the idea of reasonable design of programs versus evidence-based. What does reasonable design mean? There is no definition of what reasonable design actually means. And so one person may think it's reasonable and the other says, I don't think it's reasonable at all. So we need better definitions in those areas. And of course, when you try to come up with better definitions, you should first of all, at least in my mind, look at the evidence. Is the evidence there to support these, and of course there is a lot of evidence. And then there are very few partnerships between communities and employers. Now when I say that, I don't mean that employers aren't engaged in their community. But how often do we see an employer make an intentional, strategic decision to support community health long term? And that doesn't happen a lot. Yet again, at the same time, when you think about decisions over the longer term, investing in childhood education, as an example, is probably a 20-to-1 return on investment. It's a very, very good investment for society, for community, early childhood education. Employers can play an important role in that, and it only takes you 15 to 20 years before it pays off, because that child today, in 15 to 20 years, is your new employee. That's not a long time. It really isn't, when you think of it in a different way. So the linkage between employers and communities is a very important linkage that needs to be much more intentional from our perspective. So then to talk a little bit about the workplace itself, the workplace is changing, and we've already heard yesterday and today issues around aging of the workforce, some of the changes in our communities and how it affects the workforce, the changes in contracting of employees, the changing face, if you will, of those employees inside organizations, multi-generational issues that show up. But here's one, and I'm picking obesity, context of obesity, because it's such a complex issue. The workplace is changing. Here's an example over the last 50 years of the changing needs, requirements of energy to do the job. So in the United States, we see sedentary jobs actually increase over those past 50 years. Light energy requirement jobs increase, and a dramatic reduction in the prevalence of moderate intensity job requirements. Over the past 50 years, that means that there's a slight shift of about 100 kilocalories per day in energy expenditure at work. Now, that doesn't mean a lot of energy. 100 calories is not a lot of energy. But every day, day in, day out, week in, week out, year in, year out, this accounts for 80% of the weight increase over that same time frame. So think about prolonged sitting time as an example. Knowledge workers sitting 9 hours on end in the workplace, focused on a computer screen. Or, you know, in call centers as examples, where people are on the phone in front of the computer, one call after the next, and they sit, prolonged sitting time. Sitting is just as much energy expenditure as sleeping. It's less than 1.5 metabolic equivalent. You know, so you think about getting up from a sitting position to just at least break that prolonged sitting time every 30 minutes or so. So the earlier comment on sit-stand desks, very good example of a change in a physical environment that can have a huge impact on the health of the worker themselves. So then the question is, well, if that's true, then what happened to the workforce over that same time frame? Well, we don't have many indicators of prevalence of obesity actually in the workforce. This is a slide that basically all these blue dots that you see here are nationally representative samples of workforce surveys that were conducted in the United States over the past 30 years. And what we're seeing is a pretty consistent increase, basically a doubling of prevalence in obesity during that time frame. So it brings up a couple of points. First of all, obesity is not just an issue related to nutrition. Most of the time, physical activity is sort of this latecomer to that kind of a conversation. But it really is energy balance, and that means that to really do justice to the energy balance conversation, we do need to pay more attention to energy requirements as well, and physical activity. So getting closer, if you will, to that question of the business case. So we, I think, recognizing that the workplace is in fact a place where we can have lots of interactions, lots of opportunities to work with individuals over a sustained period of time to really make an impact and also see the benefits of that impact, it starts to make at least an argument for a business case plausible. So then what is a business case? Well, one way to put it, it's a justification for a proposed project or undertaking on the basis of its expected commercial benefit. So a couple of things in that definition that sort of demand a little bit of attention. First of all, it refers to a project or an undertaking. So in other words, something has to happen. You make a business case for something, so somebody has to do something. So what's the program? What's the intervention? What's the change that you're making? So that sort of starts to recognize that in order to make a change that will have an effect, you need to have a fairly good rationale or a fairly confident approach that this program is going to work. Otherwise, don't do it. You need to measure it. You need to have some meaningful outcomes, some indicators that actually tell you whether or not the change that you're putting in place is in effect changing something. So you need a measurement approach. And then finally, there is this notion of a realization of value. Not everything we value, we monetize. So a return on investment argument, I think, is a very limiting kind of conversation. First of all, it's very difficult to do because there are many assumptions that can't be met. It's always an estimation. It's by no means an exact science. But on top of that, there are, particularly I think in an employer setting, an enormous number of value outcomes that you can't necessarily monetize. I'll just use one example. Think of a work team and how important it is for people to work together, particularly in a complex social system such as the workplace, and get along with each other and be productive that way. So social cohesion is a very important outcome of these kinds of programs. But how do you monetize social cohesion? Everybody, as an employer, everybody understands that's an important, valued outcome. But you can't monetize it. Does that mean it doesn't have value? No, it has a lot of value. So I think it's very important in this business case discussion that you actually start out, when you put your program in place, to, in a sense, create a list of factors that you're interested in. You may not be able to monetize all of them. You may not be able to even measure all of them with a certain degree of accuracy. But if you don't acknowledge that they're valued, then you will never be able to even talk about them. So I think it's important to sort of recognize those issues, because many times it's after the fact that these things come up in conversations, and the question comes in, well, what did you do here? We don't know, we didn't measure it. So stepping back then for a second and sort of thinking about this perspective from, is it only within an organization that this business case applies, or does it really have value at multiple levels, all the way to society at large? So when you think about, I'm thinking now about Adam Smith in his book, The Wealth of Nations, basically tells us that business exists for the purpose of creating wealth and increasing prosperity for people. So at that level, business has an objective to create revenue. So if you think about this at this level, business exists with its objective to generate revenue. It creates goods and services that go into the market, and it gets paid for that, which is where the revenue comes in. That revenue goes out the door partly by recognizing that it has employees that needs to be paid. Employee wages go out, but actually quite a bit of money goes into a common resource pool through taxes, through fees, supporting the broader community. That common resource pool, represented by at the national level by a gross domestic product, is a very important resource for business, because it is actually used to create health among the population at large. It does this through education, it does it through infrastructure. Remember, these goods and services need to go out into the market. You need roads, you need bridges, you need trains, all of those things. And that's a critical infrastructure to business success. It also addresses other societal priorities, the social determinants of health, if you will, that at the end of the day all roll up into a creation of health that applies to your workers and also your future workforce. Unfortunately, increasingly, a lot of that money that goes into that common resource pool is siphoned off into healthcare. So the United States today, healthcare is almost 18–19% of the GDP, of the gross domestic product. An enormous amount of money going into that pool. And you could argue, well, that is not necessarily bad, as long as it creates value. But we also know that in the United States, probably 30% of the money that goes into healthcare doesn't create value. And you could look at it as waste. Now, we don't know which 30 cents on the dollar is waste. We have some good ideas, but it's very difficult to identify those pennies. So you have to sort of tackle the whole healthcare system at large in order to get to those savings and really reduce at the end of the day the total cost of care. In addition to that, employees carry more and more of their wages into healthcare expenditures. And so healthcare is increasingly actually siphoning off and eroding that common resource pool, which is a major threat to business success. And this is why it is so important to have business and industry at the table as a strong influencer and a strong leader in this whole debate and solution sets, if you will, around what the common resource pool can do for health, because the social determinants go way beyond healthcare alone. The positive outcomes, of course, that are created out of this end up accruing back to the business, setting by workplace performance and productivity through health and healthier employees, employee engagement, job satisfaction and safety issues, attraction and retention of talent, and being that community partner and employer of choice that many organizations aspire to. So think of this as an argument why business matters to health and health matters to business, but it really is a very macroeconomic view. So we're going to go a little bit deeper. So what are these other social determinants of health that are important to consider? So when you think about the key social determinants of health, there is medical care, there is behavior, there is social and economic factors, and there are physical environmental factors, and then there is another one called genetics. Well, so if you picked your parents wrong, there you are. So we can't really do much about genetics. So let's take genetics off the table. If you then look at the variation in health that is explained by these different factors, about 20% is explained by access to medical care. 30% from healthy behaviors, 40% from social and economic factors, and 10% from the physical environment. This is according to the University of Wisconsin County Health Rankings. So it's a broadly accepted model. When we then ask the question, where does the money go? How do we invest our resources? You'd say, well, we should certainly pay attention to behavior and economic and social issues because they make up combined 70% of the variance in health. The United States, where do the actual healthcare dollars go? 88% goes to medical services, 4% to healthy behaviors, and 8% goes to somewhere else. This is the fundamental problem that the United States faces. By comparison to other OECD countries, 2 to 3 times more money spent on healthcare, but yet we rank about 35th in terms of health outcomes. So lots of investment, little value. So what do you need to do then to rectify or correct that kind of situation? Well, we know from several studies that have looked at this issue, this balance between an investment in medical programs and an investment in social programs is very much linked to the health outcome of the population. In the United States, we have about an investment of 55 cents into social programs for every dollar invested in medical care. In other OECD countries like the United States, it's complete opposite. It's about $2 invested in social services compared to $1 in medical. And that basically is a fundamental difference why these things don't align. And this is one of the reasons why certainly over the next 10 to 15 years, the United States is going to have to change that picture because it's not sustainable. So then this broader context, from an employer perspective, there are certainly things that make sense, looking at this at the macro level, why an employer would want to invest in health. So for example, reduce healthcare spending. Most of the time when we talk about the return on investment on healthcare spending, it relates to the context where at baseline there is so much money going out the door for healthcare. Then we do something and it changes the slope, so it's lower, and the difference at the end of that measurement period is the return that you get on your investment. The problem is that at baseline, the costs are already high compared to healthy people because they're unhealthy at baseline. So when you think about health as a differentiating factor on how companies perform in the marketplace, the healthier your people, the lower your cost in the first place. And every time something bad happens in terms of health outcome, you hardly ever see people return to baseline values on the cost perspective side. And that's why healthy people at baseline are so important. Keeping healthy people healthy is even more important. So just investing in treatment is a bad idea. Investing in keeping healthy people healthy is where you're going to make your money. Reducing illness burden. At the end of the day, when you think about health, what is health really? It really is all about function. So function shows up in people's lives by being able to live a productive life, being able to do things with your family, with your kids, with your grandchildren. And when you show up at work, it becomes workplace performance and productivity. It's about function. Reducing illness burden is about being more functional. It's about feeling better. Reducing the likelihood of becoming ill. Reducing the number of people that get a disease or an illness. Making healthy choices easy choices. Changing that environment that doesn't make it difficult for people to make a choice and stick to it and be successful at it, but making it much more easy to decide to go down a certain path that is healthy in the first place. Maintaining or improving economic vitality, particularly in larger regions where multiple employers can work together in business coalitions or business partnerships, work along, multi-sectoral solutions that bring in public health, school systems, to see these economic vitality of regions show up, because economic vitality turns into health benefit again. Reduction of waste, as we just said, 30% of the healthcare dollar in the United States can be viewed as waste. Increasing longevity goes to my earlier point that as people are healthier, they're going to live longer. But they also reduce the time that they are ill before they die. This notion is referred to as compression of morbidity. Because of that compression of morbidity, shortening the time that people are ill before they die makes the argument that the benefits you get from health interventions is immediate. You don't get healthy years at the end of your life. You get them today. And that healthier years is higher function, more productivity, happier people, better workplace. Enhancing national security. In the United States today, the #1 threat to acceptance into the military is obesity. So recruits, young recruits that want to go into the military do not get accepted because of the primary reason being obesity. So now a health factor has actually become a concern for national security. And of course, on top of that, the military is a very large workforce. And then finally, preparing communities for the workforce. The workforce of the future are the children of today. So there are some real good reasons why business and industry needs to be at the table. From a business case perspective, these are very powerful arguments. To just use obesity again as an example to get to this notion of where is the value when you think about health. When we look at these examples of the percent of work limitations and thinking of it in the context of obesity and overweight, normal weight people, overweight people, and obese people. Overweight doesn't carry the risk. It's obesity that carries the risk. And in fact, what you see here is that along age strata, 20 years to 40, 40 to 60, 60 and over, you basically see a doubling of risk associated with workplace performance due to a health factor such as obesity. But the story doesn't end there. While it's a doubling of risk and it's almost linear over time, actually obesity as a risk factor is akin to 20 years of aging. So regardless what's happening at the workplace in terms of work limitations, people go home at the end of their work shift. And that limitation in their work actually shows up as aging across all of their other activities and their quality of life in other settings. And as we all know, the same person that showed up today for work is coming back tomorrow again as well. So identifying opportunities for people to actually gain energy throughout the day, go home stronger in the afternoon than when they came in the morning is a good idea, because tomorrow they bring their best self back to work. So here is one example of a very complex issue, obesity, one issue in and of itself that affects the performance of an individual at work that really is directly linked to value. So then the question is, if you then are going to do something about it, what will work? So you need to take a look at the evidence. So we've done actually several in-depth systematic reviews of all the scientific literature available on these topics. Some of these come out of the Community Preventive Services Task Force in the United States. There are other task forces like that around the world, notably the NICE in the UK as an example. And NICE, I think, does a great job of translating these results into practical guidance. But here's an example of a series of studies actually conducted for the purpose of looking at workplace as the setting. In this particular example, and the reason why I picked this one out is because it goes directly to the heart of design as well, is to look at assessments of health risk with feedback. So these are health risk appraisals, biometric screenings, basically assessments of health that are done to give an individual worker some feedback about their health status. The question then that we asked is, if you do that, is that a good investment of your money and your resources because it creates a strong outcome? It turns out actually, if you look at the effectiveness of assessments of health risk with feedback by themselves, is not a good investment. There is no evidence that shows that actually health improves as a result of that. However, if you add to the assessment follow-up health education programs and other additional interventions, all of a sudden that insufficient evidence turns into strong evidence of effectiveness for health outcomes. So from a design perspective, if you're going to put money and resources into programs to actually make a difference, don't just put in screening programs, because it's not going to give you any return on your investment. Put in screening programs with follow-up programs so that people can do something about it. And that's when you're going to get a better return. So from, again, an effectiveness perspective that goes directly to the heart of a business case, design of your programs becomes critical. Of course, we have to ask the question on return on investment. And even though I said earlier, I think it's a very limiting discussion, it is an important one. There is still a fiduciary responsibility, and your chief financial officer will ask the question. So when you do ask that question, is there evidence that return on investment is a positive one? So here is an example of a systematic review and a meta-analysis from David Cutler's group at Harvard. I would say one of the top health economy groups in the world. Their contribution to this literature is basically showing that from a medical care perspective, for every dollar invested into these kinds of programs, you get about $3.25 back. In addition to that, and independent from that, absenteeism is also affected to the tune of $2.75 for every dollar invested. Because these are independent, arguably, you could say there is a 6-to-1 return on investment. When you look at these programs, there is a lot of methodology underneath this that recognizes that the stronger studies that are out there actually show less impact, and the more liberal design studies show more impact. But really, at the end of the day, it goes back to design. If you have a program that's designed well, it's more likely you're going to get a return. So this particular study has been referenced quite a lot. People refer to this particular study all the time around the return on investment approach. But there are other studies that are, I think, almost as important. And this one, you hardly ever see, but I think it's an absolutely brilliant study. What these researchers did, and this was published in the Harvard Business Review a couple of years ago, they picked companies that are the type of companies that show up here at the Global Healthy Workplace Awards as finalists. companies with a track record of strong programs, long-term, sustained over time, well-known programs. And these companies then opened up the doors to these researchers and said, you know, take a deep dive. And what do the researchers find? They find that these companies, and this is across 10 companies, they have lower healthcare costs than other organizations in their space. They have greater productivity by various measures of productivity, and they have higher morale. Now here's an example of a value, as a business case, a strong value factor showing up, morale. I'm not sure how you monetize morale into a return on investment estimation, but obviously morale is very important to a company. But the ROI that they looked at, the one that they measured, is about 6-to-1, which is identical to the earlier study results from Cutler's team. This study, though, goes a little bit deeper and says, okay, it seems to be, from a financial perspective, actually a pretty good investment. 6-to-1, you know, maybe it's half, it's 3-to-1. That's still a good investment because all the other stuff you get. But what do you need? And this is where we start seeing these design principles show up. So in this particular study, leadership at multiple levels. Strategic alignment with the company's identity and their aspirations. Why do we exist? A design that's broad in scope, in relevance, and in quality. Broad accessibility, easy to access for people. It's possible to improve health. Internal and external partnerships across divisions, across departments, but also outside of the organization. And you got to tell people what's going on, a good communication plan. So the how is starting to get recognized. So we looked then at the literature again, went back to the literature and find out what are the kinds of things that really make a difference. We identified at that point 44 best practices, not just looking at scientific research, but also gray literature, case studies, examples from experts. And we organized them into design principles. These design principles included leadership, relevance. How does this relate to me as an individual or to me as a company? If it isn't relevant, I'm not going to sustain it. Partnership, comprehensiveness, implementation, engagement, communications, data-driven, and compliance. Compliance hardly ever shows up as a design principle, but it is good to follow the regulatory requirements and have a legal program. These design principles have now been validated in a variety of publications, including the American Heart Association presidential guidance. So let me ask you, we're just about at time out, lights are going on here in a minute. Do you think health and well-being programs can improve health and generate savings? Have I been able to at least convince the naysayers in the audience? I hope it's a yes. But it depends. My message to you back is it depends. Good ones do, bad ones don't. So these design principles are important. You're going to hear in a minute about this particular study, so I'm not going to spend any time on it. But clearly what needs to happen is that if individuals at the end of the day need to change, they need to have supportive environments to do so. So let's change the slope of that hill that people are going up by looking at environmental and policy interventions. And here's just a quote to finish up from one of our CEOs, basically saying, if you do this right, at some point you start seeing earnings on operations. And I don't know how else to make a better business case than saying it this way from the mouth of a CEO. So thank you, and I appreciate the time we had together today.
Nós agradecemos
thank you, Professor, for his presentation. Now we are breaking for coffee. In truth, since we are running late, we are not going to stop for the coffee break. In fact, we have another panel this afternoon, and then the award giving session. So we are now having the panel investing on healthy workplaces. Is this a good investment? For which we invite Mrs. Susana Benarrubia from the Deutsche Bank. We also invite Ray Fabius from Health Next USA, and the chair will be Nico Pronk from Health Partners, also from the US. For us to continue our activities,
so let me ask Susanna and Ray to come up for this panel. Strange, I have a feeling I've been here before. So I think you really have a treat today to have these two panelists. I think I'm looking forward to this session because of the people that we've been able to persuade to be here today. You know, I think in terms of introducing this session, the notion of human capital and healthy human capital is trying to sort of what we're trying to get at here. What is the value of healthy people? And so maybe posing it as a question of, does health create wealth, or does wealth create health? Is an interesting one to pose to you. Certainly at the macroeconomic level, we know that wealthy nations tend to have higher levels of health. And healthy nations actually do produce more wealth. So at least at the macroeconomic level, this appears to be true. And it also appears that social spending, as we just talked about, is a good investment in terms of health, and in fact is productive for health. So I think based on these observations, it is reasonable to conclude that business engagement is critical to matters of health, both for their own organization as well as the larger community and society. But it is about this intentional approach. Yes. So I think from the perspective of bringing health and wealth together, we have Ray today basically coming at it from a health perspective and seeking investment in health so that we can get to wealth. Susanna is going to really take the other end and say, from a wealth perspective, in order to get the best outcome and the best investment portfolio, we want health to be there. So we have two people coming at it from different angles and meeting in the middle. And so with that, let me invite, I think it's Ray that goes first, or Susanna? Susanna first. Thank you.
I think I have to bring down this. So hopefully you can hear me now. Yeah. So thank you very much for giving me today the opportunity to give you the investor view, some kind perhaps we have a different perspective, but at the end of the day, what I've been hearing today for today and yesterday really implement very much what we do, why we do it, and how we look at all these issues. So perhaps just coming from the investor perspective, obviously like any other institution or any other individual, we have been doing this for the last, let's say, couple of years. And this is really like a trip that we started in 2008, much more deeply. And we are trying to develop every single year in the way we are looking at these issues, how we can get much better information and how we can input this into our evaluation and investment decisions. So this kind of development within the Deutsche Asset Management Company has been very, let's say, done through different steps, all of them with the same target, and is that helping us to very support our investment process and give to our clients who are investing their money the best of our fiduciary duty so that they are investing with the less risk possible and the best return. And some of the things I would like to mention, obviously we have done much more things than just what you are seeing there, but I think there are different key steps for an asset manager that is really setting the place to develop all these issues in the investment process and is really moving the whole investment community, not just Deutsche Asset and Wealth Management, but also globally a lot of other asset managers to integrate what we call ESG factors, environmental, social, and corporate governance factors in our investment decisions. And obviously health and safety is one of the key issues in the social part, like we will be seeing. So one thing I think you should really keep in mind after this presentation are the United Nations Principles for Responsible Investment, which is an initiative that started a few years ago. Deutsche Asset and Wealth Management became a signatory of that, like you can see here in 2008. And you will see at the end of the package the 6 principles you are committing yourself if you become a signatory of this initiative. From these 6 principles, there are 2 that are key in this context we are discussing today. One is to commit themselves to integrate environmental, social, and corporate governance factors in investment decision and analysis. And a second important principle is that the asset managers are putting pressure in the markets to get much better disclosure and much better information so that we can really integrate that. Because it sounds, perfect, yes, please integrate. But to integrate, we need the information before. So if we don't have that information, then obviously we will never be able to integrate that. One thing that is also in this context of disclosure is moving the space, and I have a good example at the end of the presentation, is reporting of companies. So we have seen over the last years a very big development on corporate responsibility reports coming from the company side. Some of them, are part of the culture of the company. Some of them are very well designed, and they are really trying to reach a few things for the company. But other companies are doing this just because it has become a trend, but they are not really integrating these factors in their strategy, in their incentives, and in the way they are really taking care of the company in order to create value in the future. So one initiative, also global initiative, that has become even more important is the Integrated Reporting Initiative. And I will show you an example why this could be very important for the future, at least for asset managers and for investors, in order to be able to really integrate this information and these factors into our investment decisions. So, like I mentioned to you, our key target could be different, but I think is really an important part for us. If the client is coming to us and is giving us money to be invested, then obviously this client would like to have the highest return with the less risk. And this is exactly why we decided to integrate environmental, social, and corporate governance factors in our analysis. Because at the end of the day, it's increasing the return of the companies and give us a much better feeling if these companies are able to reach those returns they are telling us, and we will have a much better feeling on which are the risks that these management teams are running in order to reach those targets. So when we put all of this in place at Deutsche Asset and Wealth Management, we started like perhaps not the typical way we have been seeing here in terms of leadership, but we were like in a small team within the equity side trying to see how we could integrate this. So our job for the first years was just to take this information, to buy actually this information, to integrate that in our systems, and then to start to train our people in order for them to understand why these issues were so important and how should be the due diligence that they should follow in order to be able to integrate these factors. So it was firstly in 2011 that when we had already all of that done, that we got the strong management support within Deutsche, and these kind of factors were officially integrated in our investment process. So it was not just something we were speaking about, it was something coming in all the presentations for all the funds of Deutsche Asset Manager. And what you see this kind of integration was exactly at this part of the investment process, at the security selection process. So whenever you are facing and you are meeting a company and you would like to decide if it could be a good investment for your clients, then we follow not just the evaluation exercise, what we do obviously, but also a comprehensive company analysis trying to see how different factors will be affecting the competitive position of this company so that they are able to really create value in the future and with which level of risk. So in this kind of graphic you see here, and really I think this will be key for the whole presentation today, if you would be an investor and you have to decide what information you would like to integrate and where you should integrate this, then you have different levels and different parts. One part of the analysis is obviously which is the competitive position of this company, and how, and we hear that already several times today, how are the global trends affecting a company? And you see that in the top. So global business trends, which is the impact that this is having in the different stakeholders? So is that something that are affecting just customer preferences? Is that something that is affecting employees? Is that something that is affecting the way you are doing business, your business model? So you really have to assess which are these global trends, which is the impact in the different stakeholders, and which is going to be the reaction of those stakeholders affecting all the other points you see here, like industry environment. Are we going to see regulatory changes, like we have seen a lot on the environmental side, for example? And is that something affecting then the business model? Is the company reacting? Is that part of the strategy? Is that part of the management culture and management way of thinking? And at the end, we could integrate this in different ways. So like any other development, the way of integrating these factors has been really changing and developing over the last few years. The first thing we did internally were to put all of these factors together and just become with an ESG rating. This is obviously something that are giving you a kind of level of quality that the company is reaching in different aspects. But it's not really the kind of integration you could really do if you put all these factors together and how is this affecting the different pieces. So the second part could be just to focus on carbon footprint, which is very, very related to the environmental side. And then the reputational issues, which are key for us, because unfortunately, we faced several times management teams and companies saying that they have perfect models, perfect programs, like we were hearing right now, the design of the programs and the policies are affecting the company in general. But on the other hand, we had a lot of different controversies in different aspects, which really show that policy perhaps is perfect, but this is not really working. So we are not interested in theories, we are not interested in just policies, but we are much more interested if these policies are really impacting the value of the company on a positive or on a negative way. So some of the factors that we look at, because I don't want to leave it at just E, S, and G, is, for example, in the social side, like I mentioned to you, health and safety, labor relations, employee attraction and retention. We will go much more deeply on all these issues and how this will be taking part of our analysis. But at the end of the day, like I mentioned to you, and you see now this is much more well explained here, what we want to see is how these general responsible business practices are really affecting the benefits, the performance of the company in different ways, how these practices are reducing risks, which most of them could really damage not just the value that the company is able to create, but also the reputation of that company, and perhaps and probably also the capacity that they would have to attract talent to the company. And at the end, we try to put everything of this information on a return analysis. Is really affecting positive or negatively. Then, how is this affecting the cost of capital, which is really a key part of some of the evaluation methods, like discounted cash flows, and try to come to a company value so that we can decide if one stock or one company in the stock market is really, let's say, underappreciated or undervalued, so that we can reach this return for our clients. So I mentioned just a few minutes ago that, whenever you would like to invest, you see a lot of companies. We have in our offices like 2,000 management teams per year visiting us, CEOs or CFOs of the companies. And we hear different stories. Unfortunately, sometimes, not just in the health and safety part, but also there, like I mentioned, very nice targets or very nice comments like, we have a zero fatality policy with us. But whenever you start to ask how they would like to reach that target, then really at the end, you see that there is nothing behind. What I'm trying to tell you is whenever we hear a target or we hear a conviction, we would like to also see other issues supporting that, so that the reliability of this, or what this management team is telling me, really is very high. And we look very closely, like you see here, on one side, which are the implementation and the actions that we are taking into account in order to reach our targets in terms of, for example, health and safety. On the other hand, we would really have a leadership. So it's really the governance of the company, top management, board, and top 100 managers initially, perhaps, supporting this process and these targets. On the other hand, if you really would like to reach something, I would tell to you, are you going to put your effort as a main priority if this is not part of your targets, of your official targets? Perhaps you do it, but I don't think you will be investing the same kind of amount of energy as is this really key part of your own objectives. And this is what we try to see. Tell me, what is your strategy? Which are the actions? Are you really leading this process? And at the end, if you have some targets, when you would like to reach them? And do you really have a link between these targets and your remuneration? Because if you see all these elements together, I tell you, the probability that they will be reached, if they are reasonable, is probably much higher than if you just have like a comment and nothing behind. So like we have here several times, obviously we have also some as agnostics colleagues. Sometimes not all managers are also supporting the same ideas. So for us, over the years, has been very key to follow academic studies, which has been trying to analyze and to see if there is any evidence between the integration of ESG factors and the performance of the company in capital markets, or if is there any linkage between the integration of these factors in the strategy of the company, or what we would say, is this company having responsible practices and their operational performance? The other impact that has been also been really analyzed over the last few years has been impacts on the cost of capital. So we have had a lot of different academic studies, but I thought just because this one, which is very comprehensive meta-study, we've got from Oxford University, was published in March this year, you see that some of the key findings, and I think they are really very supportive for all of them that are still not believing that responsible business practices in all three dimensions are having an impact on the stock performance. You will see here that from 2000 to more than 200 academic studies, 88% of the research really showed that solid ESG practices was having a positive impact on the operational performance of the firms. Additionally, like you can see here, 80% of the studies show that the stock price performance of these companies in the capital markets was also positively influenced by good sustainability practices. So this together with the fact that from all the studies that were looking at the relationship with the cost of capital, we also saw that 90% of the studies were really confirming that sound sustainability practices were really reducing the cost of capital of the companies. And if you look again and think about what I told you, which are the impacts that responsible business practices in all dimensions, but also in health and safety, really have in the business, on one side is probably the operational performance, which is at the core of what we try to measure. On the other hand, is impacting the value of these companies in the capital markets, what is obviously what we would like to see, because if we buy a stock and it's not moving in value, then obviously we are not going to have a return for our clients. And the third part, obviously, if you are reducing your cost of capital, this is also having an impact on the discount factor we use to have and to measure our valuations. So you do ask now, it's good, you have made your own process at Deutsche Eastern Wealth Management. You have now some evidence coming from the academic studies, but actually, I don't know, so which is really the kind of information you are looking for? I mentioned that already. So we focus our efforts in our company to analyze different aspects of ESG, so environmental and social and governance. We look at the reputational risk, and we just separated also the carbon footprint because it was a much easier thing to measure and having also a big impact on the cash flows of some companies. So our methodology we have been using for the last few years has been the one you see here. So we are measuring companies and giving them an ESG score of 100 points, and this is related to all three columns. 40% more or less, and this is a little bit changing depending on the sector and the materiality of these issues for that kind of sector. One is on environmental. On the social part, you see around 30%. So within the social part, this 30% will be distributed between four parts. One is your employees. The other one is partners and supply chain, then clients, and then the society. So these are the different parts we have been discussing over the last few days. Is that just your employees? Is that just employees and family? Is that just the communities? So we try to see which is the impact of the companies and of their practices on all of these parts. You can imagine that companies will have to start at the beginning with their own employees. So just with companies that are very far already in terms of their own employees, then we expect as investors that they go and they apply those kind of best practices also in their relationships, in their value chain, in their supply chain, and also on the contractor side. Because I tell you, if an oil company, for example, is very good with their own employees, and they have a lot of different responsible practices, but to make a project are taking like 5 or 6 different contractors, and they are not responsible, then at the end, this is not the kind of best practice you would like to see also from the big companies. So we take care of all of these things, and just on the right-hand side, you see these small information in yellow. So these are the number of indicators we use to measure which is the performance at the different parts of the social issues. So this has been our model for the last 7 years now. This information at the moment is just coming from one company, which is really taking this information from the annual reports, from the corporate responsibility reports, and are putting that information in the same format for all the companies, so that we are able to compare, to see what the company is doing, but also to compare that to the peers. Because at the end, it's a relative way of thinking. So we have to invest our money, and we would like to invest that in the best place. So at the end, you really have to look how is this company also performing versus the peers. Going forward, we are thinking, and we are working at the moment on that, just to introduce other vendors and not just the one we have at the moment. So in order to do that, we are looking at the moment at the most important issues within ESG and try to start with some of them in order to see if the KPIs and the metrics we are looking at the moment, if they are the right ones, because 7, 8 years is a long period of time. Things have changed. Quality of information and disclosure of the companies had also changed. And perhaps we can change also the KPIs looking at more materiality and relevance for our investment decisions. And this is exactly what we are doing today. Some of the top factors you see here, labor relations, like taking employees on a much broader view. On the other hand, you have here, for example, employee health and safety. So we would like to, and we have started just with health and safety because it's something that is really affecting all the industries. Perhaps safety is much more relevant, for example, in the oil companies or utilities or mining, but does not mean that it's not important for other companies in a different way. I mentioned to you that one of the key things we look at the controversy report, what is also integrated in our model, you will see that later on. And here we put a special attention on companies that are reaching on the controversy level, what is also a risk level, controversy number 4 and number 5. What that means at the end of the day, that these companies have a lot of accidents or a lot of cases or a lot of problems with their employees. One example we had was a company with a very good ESG rating, like the best one, an A rating, but on the controversy level, they were having a lot of suicides within the company in such a way, in such a amount that you really thought something is not working here at all. So the policies perhaps are looking very well, but something in the culture, something in the way that management were behaving was really affecting this company in a very negative way. So we look at this as a way of telling us, don't invest, or take care, there are a lot of things here, and perhaps this is really becoming really a reputational problem, or even much more than that, just because costs are increasing within this company in the next few years. So what you see here is just like a summary, how we see this information in our system. So we have a global database where all the analysts are putting the recommendations for the different stocks. You see the ESG rating of these companies. And if you just click on that company, you see here which is the ESG rating for every of those categories I show you in order to give them the ESG rating. So you see here a comparison between a global universe, if this is a company that is not located in Europe, and between the European universe. You will ask yourself why to do that. On ESG factors and integration of that, and taking that into account, having European companies much more active over the last few years. So usually, what could be the very best rating on a global universe comparison, like an A rating, is very often a B rating in Europe, just because in Europe the performance is much better. So ratings, I forget to tell you this, and I think this is the beauty of the system, is that the ratings are given on a relative basis. So if a company is top today and is applying the best practices, but is sleeping for 2 or 3 years, is not really following these issues and adjusting, then probably in a few years' time, this A rating is going to be a B or a C rating. So with this method, obviously, companies are asked to improve every single year and be active in looking at the best practices in their sectors and in the best management teams that they can see in the market. Okay. So if we go deeper in this thing, and we have to assess why investing in healthy workplaces is really good to create value, we have different levels of assessment. These different levels and these different phases is depending on the information we have from the companies. So the very first part is just assessing the global trends and the impact this will be having on the different setups of the different companies. We have been already seeing these impacts and being explained very deeply this morning. The second part of the assessment is to see how these general trends will be affecting a concrete sector and a concrete company. Then what we try to put a special effort, because this is the most kind of granularity we get at the moment in the information in order to compare the companies with the peers, is to look at the certifications they have, is to look at the programs they have, and how is the transparency that they gave to the market on how these programs are working, which are really the challenges, how they have been improving, and which are the targets that they are reaching and trying to get over the next few years. So looking at the impacts, this could be the perfect well if investors will be receiving from the companies, which is really the impact on the financial performance that all of these practices are having. Till now, we have not seen a lot of different examples with respect to this, but this year, in the last integrated report of one European IT company, we saw that this was the first intent, not just to measure something in terms of metrics, but also to see which could be the impact on the operating profit of the company to reach different measures. So this company focused on different things, but I would like to show you just they look at the employee engagement and they look at the business health culture index, and they came to the conclusion, doing own correlations internally with their own information, that 1% change in the employee engagement could have an impact of 35 to 45 million impact in the operating profit. On the business health and culture index, they saw that 1% change of that would have an impact of 65 to 75 million euros in their operating profit. So this is the kind of thing we are waiting and expecting to see from the companies, which could be very helpful for the investment community. Just because I have to come to an end, I think the time is not there anymore. So key conclusion I would like to give you is, I hope that the companies will continuously improving the disclosure. I hope they will be taking seriously these issues, because it's not just Deutsche Asset and Wealth Management, but it's the whole investment community who is integrating these things. And at the end of the day, giving this to the markets will have surely an impact also on the stock prices. I hope this was interesting for you. Thank you.
So I've been told that due to the lateness of this session, I should be more brief. But I do want to say that it is a great, great honor to be with you today. I am certainly shocked and amazed at my own journey. I have come to this podium with a good bit of interest and personal passion in helping populations get healthier. And in my pursuit of that, I've had the chance to be the global medical leader of General Electric and Chief Medical Officer of Thomson Reuters, and to do a good bit of publishing and teaching. I want to let you know that a textbook that I helped to create called Population Health, Creating Cultures of Wellness is now the leading textbook on the subject for colleges and medical schools. And I bring this up in part if you have more interest in this topic than I can possibly present. I would suggest getting a copy. But even more importantly, I would love to hear from those of you that would be interested in helping me translate this textbook in other languages. In the brief time that I have with you, I've been asked to identify quite clearly what are the values in investing in a healthy workforce. And in a way, this is a wonderful summary, and hopefully a quick summary, of our conference together over the last 2 days. Certainly, it's clear that a healthy workforce will reduce medical expenditure. And this is true whether or not you're speaking about a company that's responsible for the costs, such as in the US, or even in socialized healthcare systems where companies are either directly or indirectly taxed for increasing illness burden. Perhaps the best study, in great deference to my colleagues who are actually here from Johnson & Johnson, the best study that I know of looking at the return on investment and evidence of a culture of health is one that was generated by my former company, Thomson Reuters, now Truven Health Analytics, and Johnson & Johnson, where they showed over a very extended period, while other companies' healthcare costs were going up, theirs were not, and they saw in their study a 2-to-1 or 4-to-1 return on investment just due to healthcare costs. More recently, research done by Thomson Reuters and now called Truven Health Analytics showed that there were 8 companies whose healthcare costs now are going down. So the new goal for benchmark status is to demonstrate that your workforce is getting healthier over time and that your healthcare costs are actually decreasing. Why this is important in a global setting is healthcare costs are just a proxy for illness burden. And I would like to just share with you that I've been told that this is an important saying in Brazil, and we say the same thing in the States about the importance of prevention, so much more important than treatment, as has been spoken about throughout our conference together. If you look at this as a physician, I can't help but show you an x-ray, but here you have someone with a normal chest x-ray who takes up smoking, and then they get recurrent bouts of bronchitis and pneumonia. Sometimes they have to go in the hospital. Nobody thinks that much of it, but they do lose time at work. And then eventually, because of the smoking and because of the effects of these infections, they start to get emphysema, sometimes requiring oxygen. And then ultimately, because of the noxious effects of the recurrent infection and also the chemicals of smoking, the body cannot keep up with the mutations that are occurring in the lung, and you have, as a consequence, a lung cancer. So you have a normal, thank you, you have a normal person who takes on a risk factor and then has acute infections and then has chronic infections and then has a catastrophic illness. So where, as a society or as an employer, would you like to apply your resources? Presently, across the world, most of the resources are applied here, but we would suggest upstream is very important. The same is true in behavioral health, where first people have stress, then maybe they burn out at work, and then maybe they're depressed, and then maybe they're suicidal. So they have a risk factor, then they have an acute illness, then they have a chronic illness, then they have a catastrophic illness. We're going to move on now in terms of the value of health to speak about productivity. Most human resource people across the globe have been trained that they will do a great job if they can find people with the skill and the will. That's why when you apply for a job, they ask you for your CV to see if you have the skill, and then they interview you to see if you have the will. But equally important, we're finding now, is to not be ill. And that actually impacts on presenteeism and its association with waste and the full impact of disease. What happens when somebody is sick is first they're not doing their work well, then it's not on time, then they're absent from the workforce, temporarily, and then they're totally lost to the workforce with disability. All of these are very, very, very costly to society and to corporate America. And I know that this is one situation where I would recommend Brazil not follow the United States, but this headline here suggests that you may actually match our obesity by 2022, and the girl from Ipanema is changing. As was identified by Nico, it winds up that really as you move up obesity levels, medical costs go up, short-term disability goes up, workers' comp goes up, presenteeism goes up, absence goes up, and when you add all these things together, dear CEOs in the room, it would make sense to have a scale at the entrance of every workplace so people can weigh themselves every day, because a pound of increased weight will impact on your work performance. This is very important for all of us. We must fix this. A very interesting study done by a global tire company showed that there was a direct correlation between medical costs and the waste at each one of their plants. This represents different plants. And at a plant where their medical costs are low, their waste is low. And for every $1,000 of reduction of healthcare costs, there was a $2,000 increase in output or reduction of waste. Clearly, as a workforce gets healthier, they have less mistakes and you get higher production. When you look at this in total, dear CEO, for every dollar that's spent on healthcare costs, there's $2 or $3 spent on productivity loss. The issue is not medical costs. It's really about productivity. When you have a healthy workforce, they're engaged in two ways. First of all, they're more engaged in improving and maintaining their health. Second of all, they're more engaged in the work. And in deference to Elaine Molina and her project with Unilever called the Lamplighter Program, one of the best parts of that study done by Unilever was to show that top performers also had the healthiest health score. I know this is intuitive. I know this is logical. I don't even know sometimes why I have to make these studies, but it is clear that a healthier worker is much more likely to be a top performer. There is still another way you get value. You get value by being the employer of choice. So, Goldman Sachs has their culture of health to retain and attract talent. Yum brands like Pizza Hut and Taco Bell have their program to reduce turnover. And when you look at companies that are recognized to be the best companies to work for, it's often because of their health and wellness programs. Because when you tell employees about taking care of themselves. You express to them how much you care about them, and then they care more about the company. With the few minutes that I have left, I want to tell you about some very interesting research. Years ago, I was also the president of a company that provided workplace clinics. At the time of the company's sale to Walgreens, we had over 500 workplace clinics for about 100 large employers. Many of them were publicly traded. And so I asked my financial people to pretend that our clients who put in workplace health centers were a portfolio, an investment portfolio. And I wanted to know whether those clients would outperform the indices, the Dow Jones Industrial or the S&P 500 indices that we normally use in the state for comparison purposes. And they did. I wasn't bold enough to say, dear CEO, if you put a healthcare clinic in using my company, your stock will go up. But I was starting to recognize that companies that really pay attention to the health of their workforce might be good investments. And in fact, a research project by Towers Watson, a big consultant in the United States, also did research to show that companies that pay attention to the health and productivity of their workforce do outperform in the stock market. And so there is an organization in the States called the American College of Occupational and Environmental Medicine, and every year they give away an award, like we're giving away here, to companies who have built a culture of health and safety. But they've been doing it since 1996. And so I pretended that the publicly traded cohort of those winners was a portfolio. And I also wanted to know whether it would outperform the S&P 500 or the broader stock market. And this led to this article, which showed remarkably so that investing in companies that invest in health and safety is a good investment. These are some of the companies, including ones that have been mentioned and have received awards from this wonderful platform. I want to share with you that my new company, Health Next, has developed a methodology to evaluate an organization's culture of health out of 1,000 points. We've identified 218 elements in 10 categories, and we can provide a company with a heat map so they can see what they're doing well and what they're not doing well. For example, your award-winning companies would likely score in the 700 range. This is benchmark, but most companies that we work with score around 350 to start with, and we build them a strategic plan to get to benchmark in 3 years. Using that methodology, I have, since 2009, started my own portfolio. Right now it has one investor, me. And this portfolio, started in 2009, is the equivalent of the Dow Jones, what we would call 30, or it's the companies that my methodology suggests are the top 30 or so companies in the world that take the best care of their workforce. And this portfolio has been outperforming the indices now for 4 percentage points per year, now for 5 years. Actually not an easy thing to do because the stock market itself, as you may know, is doing quite well, particularly in the States and even across the globe over this period. So to share with you, I'm in negotiations right now with the NASDAQ to start a culture of health index. And so what is really fascinating is I started my career as a primary care doctor outside of Philadelphia, and today I get a chance to share the podium with Susanna and speak to all of you here in Brazil to tell you that the investment community is now looking at companies to see if they're doing a good job of taking care of the health of their workforce. And physician executives are starting to look at companies that are doing a great job in terms of building a culture of health and recommending that they be invested in. I will also share with you that there will be 3 more articles coming to support this notion that healthy workforces outperform in the stock market. And so the conclusion of my article says that while these results consistently and significantly suggest that companies focusing on health and safety of their workforce are yielding greater value for their investors, the evidence appears to be building that healthy workforces provide a competitive advantage in ways that benefit their investors. So for those of you that are board members here today, for those of you that are CEOs, CFOs, and HR leaders, a great way to add value to the marketplace, to your company's stock value, is to take care of your most precious asset, your people. Thank you.
So due to the time pressure that we're under at this point, we're going to move straight on to the next part of the agenda.
Nós agradecemos os participantes do nosso último painel, o painel Investir em Ambientes de Trabalho, Ambientes Saudáveis, é um bom investimento, foi justamente o assunto desse nosso último painel. Enquanto realizamos os últimos preparativos aqui para a premiação, que é a última etapa do nosso evento, nós gostaríamos de agradecer também a presença, há pouco, mais no começo da tarde, registramos aqui a presença de representantes de algumas empresas, bem como o Jairo Becker, senhor Jairo Becker, da Duas Rodas. Agradecemos e registramos a presença esta tarde. E gostaríamos também de pedir, por gentileza, que o senhor Luiz Lourenço se identifique na secretaria do evento, por favor. Lembramos também a todos os participantes do evento, já desde ontem, reforçamos hoje, inclusive, que na pastinha, logo na inscrição do evento, foi colocada ali, ou foram colocadas 2 fichas, uma o questionário do Pentáculo, outra a ficha de satisfação, né, que elas estejam preenchidas, por favor, o que é muito importante para a realização, claro, dos próximos eventos. Lembrando também que logo após a cerimônia de premiação nós teremos um coquetel, o coquetel que será servido, em princípio marcado para as 6 horas da tarde, se passar um pouquinho logo depois da cerimônia de premiação, bem aqui em frente, um coquetel marcando definitivamente o encerramento do nosso evento. Agora sim, passamos para o próximo momento, a cerimônia de premiação aos vencedores de 2015 do Global Health Workplace Awards, e para prestar este reconhecimento, nós convidamos para que se posicionem aqui no palco os senhores Glauco José Corte, presidente da Fiesc, Wolf Kirsten, do Centro Mundial para Ambientes de Trabalho Saudáveis da Alemanha, Tommy Hutchins,
of SESI Santa Catarina. At this moment, I pass the floor to Tommy Hutchinson to announce the first category. Please. A primeira categoria da premiação é a categoria Pequenas e Médias Empresas. The winner is Spar Bank from Denmark.
Congratulations. 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 Parabéns. Grande porta, né? Agora, lá.
Yes,
The next category.
A próxima categoria são as grandes empresas.
Anuncio com alegria.
I am pleased to announce the winner, Unilever Brazil.
Congratulations for you. Yeah, very good.
Parabéns. Aqui para fora.
And the final category.
E a última categoria, empresas multinacionais. And the winner is GSK from the UK.
Fantastic. Well done. Well done.
Thank you very much. Very good.
Parabéns, né?
Congratulations. Good job. You did a great job, man. There you go. That's for you. Yeah.
Congratulations.
Thank you. Thank you.
Thank you very much.
Ok, nós agradecemos.
We would like to thank the finalist companies for participating. We would like to thank Mr. Wolf Kirchner and Fabrício Machado Pereira. And we would like to ask Mr. Tommy Hutchinson and Glauco José Cortes to remain on stage, which they have, for the closing ceremony of the Global Healthy Workplace Awards and Summit 2015. Let us now hear from Mr. Tommy Hutchinson.
All good things must come to an end. But actually, that is not true. It's one of the fundamental laws of nature is that energy never dies. From the intellectual rigor of the discussion to the physical workouts on the beach, we have had energy at this summit, and that energy has been good. But how do we conclude these proceedings? This is the third Global Healthy Workplace Awards Summit. Our first was in London, our second was in Shanghai, but it is no way a disparaging reflection to those two great cities, but that for me to say that Florianópolis has been by far the best Global Healthy Workplace Awards Summit. There's a long list of people I would love to thank, but I hope you'll appreciate that in shortness of time I won't go through all of the names, but I will therefore just like to broadly thank the SESI and FIESC team, the fabulous hotel staff, our wonderful interpreters, and all of the many great people, including our very own band of brothers and sisters from the Global Center of Healthy Workplace. Thank you very much. We could not have done it without all of you. Second conclusion from this summit is that we will always in future live stream our events. Our audience has been huge. Our social media and email is jammed full. We are getting the message out there to the wider world. But yesterday I asked, what will be the legacy of this summit? And you will all have your own personal and professional legacies. But I would just like to, if I may, focus on some of the collective things that I'm able to announce. In regard to FIESC and SESI, with their unique vision and intelligence and their practical application of health and well-being, I am greatly honored to announce that the Global Center for Healthy Workplace and FIESC-SESI have agreed to co-create a new observatory for workplace health and well-being around the world. The formal terms will be published on the website, but let me say this. We invite all employers, all investors, all practitioners, academics and students, government bodies and NGOs, media and startup social entrepreneurs to join us in making this a fabulous observatory. In the true spirit of Santa Catarina, from the earliest settlements 5,000 years ago to the arrival of the first Europeans in 1675, our aim is to make this observatory a place for discovery. We hope that you will join us in this exciting journey. I also can announce the creation, a joint creation of a new provisional advisory committee, which will be made up of George Pfeiffer, Nicholas Pronk, Ricardo DeMarchi, Bob Kosh, Tommy Hutchinson, that's me, Wolf Kirsten, Alberto Ogata, Marcelo Torni, Eloy Sim, and Istana Ado to help in giving us direction for our future work. But our final legacy of this summit is perhaps the most important. From the works of Charles Darwin, we know that only the fittest survive. Employers, large and small, you are not immune from the laws of nature. In the court of world opinion, I believe that we have proved at this summit, beyond reasonable doubt, that the agenda for healthy workplace è molto importante. Para saúde è un buon negócio. Thank you.
Nosso agradecimento ao Sr. Tommy, e agora nós ouviremos o Sr. Glauco José Corte, presidente.
We express our appreciation to Tommy Hutchinson, and we'll now hear Mr. Glauco José Corte, president of FIESC.
Boa tarde, senhoras e senhores.
Good afternoon, ladies and gentlemen. It is with great honor that I participate in the closing ceremony of this meeting, and I do so with dual feelings. A feeling of regret and a feeling of happiness at the same time. Regret because it's been such a short time and it went by so fast. It almost always happens with all good things, even though they last. There's always a feeling that we could have stayed longer, a few more days, working and sharing our experiences and our initiatives. I think, Tommy, that even the weather helped us, because if it had been too sunny outside, perhaps we'd be remorseful of being inside for 2 days in this room. But also, there's a feeling of joy, because the topics that were presented here and discussed here certainly will not be restricted to the limits, the boundaries of this beautiful place, because their echoes shall reach countries, companies, and leaders from all continents. So we hope and trust. I inform you with happiness that we've had in this meeting of ours 235 registrations, participants from 33 countries, 65 foreign specialists, 72 Brazilian specialists, and 43 leaders and company executives from Brazilian companies, which is a proof of the interest that this topic has in people. Ladies and gentlemen, in face of the growing speed of and complexity of the changes that reach all fields of human action, economic, social, political, in labor relations, processes which almost always are not straightforward, we need to be cautious enough to conciliate the pace of progress and the pressure for competitiveness with the growing improvement of working conditions, with the quality of life of those which development is addressed to, in their immense majority comprised of workers and employees. I remember, Tommy, that as soon as I took over FIESC in a meeting with our team, I recommended that the FIESC institutions, in the FIESC institutions, we should cross out the word labor. We no longer speak of labor, we speak of workers and professionals, because we recognize that whatever the work to be performed is, it demands from the worker a certain level of knowledge. And this qualifies him or her as a professional and as an employee. I'm also proud to say that FIESC and its institutions, SESI and SENAI, have been the first institutions in the country which opened seats in their boards for workers' representatives. We have here the presence of the president of the Federation of Workers from one of the most important areas of Santa Catarina, President Ari Alano, who sits with us as his fellow workers to discuss in the facilities of SESI and Senai what the strategies are for the development of their education activities and quality of life activities. Also, in the scope of the Board of Governance of our movement, Industry for Education, there is a seat reserved for a representative from workers, from the workforce, who discusses with us what the strategies are for us to improve the educational level of the Santa Catarina worker. We have a big challenge ahead of us, but the challenges exist to be overcome. According to the report by the Conference Board of November 2008, which analyzed the 10 main challenges of company leaders, excellence in execution and consistent execution of strategies have been two of the main concerns of the senior executives. Well, we have all this big challenge of carrying out, of executing with excellence and with consistency the conclusions that we are drawing from this meeting. Starting from this meeting, we have the obligation of calling business people and leaders from all companies to advance in a more daring way in the practice of strategies which will promote quality of life of our workers. This is good for them. Certainly it is, but it is also good for the companies. I thank all of those who have been involved in the organization of this meeting. I would like to mention especially the fantastic team which organized and provided support to this meeting, which we are now closing. There were many people, many hours of work. On behalf of Fabricio and Eloir, directors of SESI, I would like to greet and express my appreciation to all of this wonderful team of ours. I thank above all the availability of all of you who have come here to participate in our Global Healthy Workplace Awards and Summit. And I wish you all a good return, a safe return home. Be sure that it will always be a great pleasure for us and for our team to welcome you again in our city and in our state. Thank you.
Senhor Glauco José Corte, presidente.
Mr. Glauco José Corte, president of Fiesc, will continue with us on stage, as well as Mr. Tommy Hutchinson will remain on stage, so that together we can all watch at this moment a video about this year's Global Healthy Workplace Awards and Summit.
É nesse cenário que pretendemos nos encontrar em 2015 para juntos darmos um novo sentido ao termo qualidade de vida. Estamos esperando vocês.
We are very excited about showcasing best programs, best workplace promotion programs in the world next month.
Este é o vídeo oficial do evento desse ano de 2015. E agora, para encerrarmos, definitivamente o senhor Tommy pediu espaço.
Now, Tommy asks to deliver a few words, final words here.
More of an official invitation. The Global Center for Healthy Workplace has the honor to invite Mr. Glacio Jose Jorge, President of the Federation of Industries of Santa Catarina State, to be our global ambassador to promote health and well-being in the workplace around the world. This invitation has been signed by myself and Wolf Kirsten, by Fabricio Pereira, by Elio Sim, Bob Kosh, and Jose Faria. But I don't think these names are enough. I think we need your support too. If you would like Mr. President to be our global ambassador, I invite you to stand on your feet and please show your encouragement.